Good morning. As a land-grant institution, we would first like to acknowledge the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar, that is the Los Angeles Basin and South Channel Islands. Welcome. Welcome to the UCLA Center for Health Policy Researchers 2023 E.R. Brown Symposium. My name is Ninez Ponce, and I'm the director of the center and a professor and chair of health policy and management at the UCLA Fielding School of Public Health. Each year, we host a symposium to honor UCLA Center for Health Policy Research founder, the late Dr. E. Richard Brown, Rick, as we fondly called him, by furthering his mission to build evidence and facilitate conversations among researchers, policymakers, healthcare leaders, and community advocates on current issues in public health. These discussions are designed to spur action to improve health in California and beyond. We thank Rick's wife, Marianne Brown, for being the main sponsor of this symposium series and for her continued support of the center. We also thank the Hope and Heal Fund, which provided valuable insights on the design of today's program. And we appreciate our event sponsors, Cedars-Sinai, the California Health Benefits Review Program, the California Alliance of Academics and Communities for Public Health Equity, and the David Bonnet Foundation, as well as my colleagues in the University of California Family, UC Irvine, the Luskin School of Public Affairs, and of course, my home department, the UCLA Department of Health Policy and Management. As in past years, we choose our topic based on pressing issues in public health. One prominent in the news headlines, widely talked about in the legislative halls, and sadly, all too real for all of us every day. This year, that issue is gun violence. People used to think about gun violence as something that happened in other places, on our television screens, in our newspapers, the headlines that we see. Now, most every one of us has been impacted, from our schools to our places of work, our churches, our cultural centers, grocery stores and hospitals, our parks and playgrounds, our neighborhoods, and right inside of our homes. Gun violence is everywhere. In the first 43 days of 2023, we have been 5,103 deaths from gun violence. We've seen that, and 3,745 injuries and counting in the United States. Gun violence disproportionately affects communities of color, especially Black and Brown communities. Gun violence not only takes lives and harms physical health, but causes long-term psychological harm to individuals, to families, and communities. There are too many tragic stories. We know the story of 26-year-old EMT Breonna Taylor, who was shot and killed in the hallway of her own home in Louisville, Kentucky. 9-year-old Eliana Garcia, one of the 19 children killed at Robb Elementary School in Uvalde, Texas, had already picked out a quinceañera dress and was practicing choreography with her older sister. Sherry Bush, a transgender woman experiencing homelessness, was targeted because of her gender identity and killed in Los Angeles. Andre McNeil was picking up a surprise birthday cake for his 3-year-old son when he was shot and killed at Tops grocery store in Buffalo, New York. Closer to home, Ming Wei Ma brought people from different cultures together through dance as the owner of Star Dance Studio in Monterey Park, where gun violence took the lives of 11 people last month. And even closer to home, Robert Gutierrez, a graduate of the Executive Masters of Public Health program here at UCLA. Rob and his wife, Gara Lee, were celebrating 20 years of marriage on December 9th, 2022, when he was shot and killed by a stray bullet in Santa Barbara. Rob was a devoted husband, a father of 2 daughters, Ariana and Carissa, a self-proclaimed and proud girl dad. After graduating from the EMPH program in 2020, Rob rededicated his career to his passion of providing care for the older adult community, recently taking on a role as the executive director of a new assisted living facility in Glendora. On the day of his memorial in January, the facility received word that the state of California had granted its license for operation. I do just want to take a moment to acknowledge Rob's wife, Gara Lee, who is joining us today, as well as all of the people here who have been impacted by gun violence. And today, we dedicate the symposium to Rob and all the victims and survivors of gun violence. Whether homicides, mass shootings, accidental deaths, or suicides, so many of these horrible events have guns as the common denominator. Gun-related incidents now cross through the criminal justice system, healthcare facilities, employment, education, involve mental health services, and every aspect of our social fabric. We set aside questions on the rights to gun ownership and focus on addressing what has become a public health issue, the endemic violence perpetrated using a firearm. We must begin to understand the risk factors for both the perpetrators and the victims. We have to understand the structural issues that contribute to the spread of violence. And only when we have a solid evidence base, that we can begin to see the path to prevention that will be effective. So the questions before us are these. Can California find policies and programs to address the underlying issues that contribute to this epidemic? What are the effective ways to stop someone from picking up a gun to use against others or themselves? How do we best help survivors of gun violence to feel safe again? How can we heal the trauma that is felt by so many in our communities? While more news stories share the daily toll of gun violence in our communities, policymakers at all levels are considering new proposals to try to stem new incidents. Until recently, federal funding for gun violence research was limited by a 1996 amendment that prevented the CDC, the Centers for Disease Control and Prevention, from using public funds for studies that advocate or promote gun control. An increased investment in research and evaluation is building an evidence base for policies or programs to inform these policymakers who are making these tough decisions. And we are looking forward to discussing some of the important data and promising programs today in this symposium. So here at the UCLA Center for Health Policy Research, we are contributing to the public health data and research that are needed. Through a grant from the National Collaborative on Gun Violence Research, NCGVR, supported by the Arnold Foundation, we added a series of questions on firearm ownership, storage, and fears of gun violence to the California Health Interview Survey. I'll refer to it as CHIS, which is the largest state health survey in the nation. We recently released the first year of data from CHIS and will be developing several policy briefs in the coming months and years. So a few of the initial findings: more than 1 in 6, about 5.2 million California adults kept a firearm at home in 2021. Among adult gun owners, 7.7% reported having a firearm at home that was loaded and unlocked. 43.1% of California adults reported being very or somewhat worried about being a victim of gun violence in 2021. And more than 1 in 4 teens reported ever holding a gun in their hands. And 49% of Black or African-American teens in California reported ever worrying about being shot by a firearm. We will hear more about some of the findings from the CHIS data in our panels today. As the new legislative season in Sacramento gets underway, multiple proposals to address different aspects of gun violence are being circulated. As policy leaders consider these proposals, we hope they will rely on the data and evidence in their decision-making process. We have 2 panels today. The first will share emerging research on many aspects of gun violence from the communities that are disproportionately impacted to the data that can expand our understanding of gun ownership. The second panel will bring together leaders from organizations such as Brady, the Los Angeles County Office of Violence Prevention, and Urban Peace Institute for a discussion on public health actions taken to fight gun violence. And later this afternoon, we'll reflect on the day and look forward to the possibilities that California's public health leaders can consider for the future. Following the symposium, we will host a session exclusively for students and youth, featuring the RISE Center and Youth Alive and Hope and Heal Fund. The link will be in chat for those who are interested in attending. This morning, we have the honor of hearing from the California Attorney General Rob Bonta, who is leading efforts to address gun violence in California, both through criminal prosecution and an investment in prevention programs, the public health approach. He launched the first in the nation Office of Gun Violence Prevention. And with this initiative, he is acknowledging the prosecutional laws are only part of the equation. We need to invest in prevention. California is committing to supporting strategic and innovative programs to reduce gun violence, and we look forward to hearing more about the program and the ways in which research can support the work of this new initiative. I'd like to thank you all again for joining us for this very important event. And thank you to our speakers, our panelists, our sponsors, our supporters, and staff for putting today's symposium together. Now I'd like to welcome to the virtual stage the Honorable California Attorney General Rob Bonta.
Well, good morning, everyone, and thank you, Dr. Ponce, for that kind introduction and for all the work that you're doing and for this invitation to join the UCLA Center for Health Policy Research today. I appreciate the opportunity to be with so many incredible leaders getting the job done every day. And I want to thank the researchers, the advocates, community leaders here who are honoring the memory of Rick Brown by building healthier communities. We're all here because we care, whether you're a researcher or a mom demanding action. We all know what's happening in our nation right now is unacceptable. Bullets fired indiscriminately, lives taken en masse on a daily basis. The pain feels particularly acute now. Monterey Park, Half Moon Bay, weeks into 2023, there have already been more than 60 mass shootings. Every bullet has the power to leave a victim, and in recent days, what once felt like a flood has turned into an ocean of gun violence, pain, and heartbreak for survivors and their families. I have the honor and privilege of leading the largest state Department of Justice in the nation as an Attorney General, but I approach ending this public health crisis as a father. A few years back, I'll never forget the moment when my oldest daughter, on the text thread that she and my wife Mia and I shared together, shared the very frightening and shocking news that her school was in lockdown because there was an active shooter nearby. I remember the feeling of helplessness, of worry, of anxiety, wanting to know information, wanting to know that she was safe, but not getting those guarantees. And fortunately, the man carrying the firearm never made it on campus, and my daughter was safe. But the hours it took to get that all clear felt like days. I remember also hearing from a constituent who was in the exact same situation with her son, terrified, confused, not knowing what information was the latest about the safety of her son, but just knowing that her son was in a lockdown. And again, fortunately, her son was safe, but this happens far too often. And for many others in our community, the outcome is not the same. Their children, unfortunately, tragically, sadly, do not end up safe. And this is simply unacceptable. We cannot go on like this. Our children deserve to grow up in a world that is better, that is safer than this, not just in their classrooms, but everywhere in their neighborhoods, communities, towns, and cities, movie theaters and restaurants and parks, everywhere should be and must be safer. And our young people don't just deserve safety, they are demanding it. David Hogg was absolutely right when on the day after the Parkland school shooting, he said live on TV, "We are children, you are the adults, take action." In California, fortunately, that's what we do. We take action. When there is an injustice, a threat to public safety and public health, we get to work, and we're doing our part at the California Department of Justice. That's why at the DOJ, we've been leading efforts to reduce gun violence for years. We're defending our nation-leading gun laws, the ban on assault weapons, high-capacity magazines, and numerous other statutes on the books that keep us safe and save lives. We're taking legal action against firearm traffickers and ghost gun manufacturers and retailers. We're seizing illegally possessed firearms Across the state, our agents have taken over 20,000 firearms out of dangerous hands since the launch of our armed prohibited persons system enforcement efforts. We're sponsoring new legislation, promoting red flag laws and supporting victims and survivors of gun violence and far, far beyond. But with 111 people shot and killed in our nation every day, what we are doing is not enough. Like all of you, we know we can and we must do more, because this moment demands more. That's why I recently launched DOJ's Office of Gun Violence Prevention. This innovative new office, the first of its kind at a DOJ in the nation, complements our existing robust efforts in the Bureau of Firearms and across our department. It will harness a public health-centered approach to reducing gun violence, expanding our lens beyond prosecuting gun crime to prevention, harm reduction, and maybe even culture shifting. The office works to reduce and prevent gun violence and trauma by providing centralized state support to implement innovative programs that I hope policymakers continue to build on. From protection orders like gun violence restraining orders to proven prevention programs like Operation Peacekeeper. We're just getting started, but when fully up and running, this new office will take a public health approach to this work by examining a broad range of factors to prevent gun violence on the front end, from firearm availability to effective resources for crisis prevention. Reducing gun violence by promoting research and data collection. We must continue to pursue and implement and enact evidence-based, data-driven policies in California. Increasing awareness about effective legal and policy strategies, and collaborating with our partners, all of you. And that's where I want to conclude my remarks today, with all of you. We need you, and ending this public health crisis requires policy solutions that come directly from our communities, the folks on the ground, from community leaders to researchers. You know what's working and where the policy gaps are. You're able to connect the dots. The fact that we know 2/3 of mass shootings have a domestic violence connection. The fact that we know guns have become the leading cause of death for children and adolescents in America. The fact that we know people with mental illness are more likely to be victims of violence rather than perpetrators is all because you have your ear on the ground, because you're conducting research that helps policymakers connect the dots. The sooner we can connect those dots, the sooner we can save lives and address this public health crisis. It's going to take everyone here. We all have an important perspective and a role to play. We are not bystanders and spectators to what's happening. We have agency, we have power, we have potency, we have the ability to change the course we've been on and to put us on a better, safer course. And together, I know we'll stand up and meet this moment. And together, I know we'll save more lives. Thank you for having me today.
Thank you so much, Attorney General Rob Bonta. May I ask you about a few questions?
Of course.
Okay, so thank you, first of all, for establishing the first in the nation Office of Gun Violence Prevention, and for looking at solutions from a public health perspective. So thank you so much. As you know, federal funding for gun violence research has been limited for many years. And in 2021, the CDC and the National Institutes of Health awarded $25 million in grants for firearms research for the first time in more than 2 decades. So in your mind, what are some of the key aspects of this field that you'd like us, there's some researchers in the room here that you'd like us to study? You know, what would like more research? What kind of research would you like to see?
Certainly, I think it's important to sort of have that all of the above approach. I don't think we should necessarily narrow what the research can and will show. Anything that is evidence-based, data-driven, supported by research that keeps people safe, that reduces firearm mortality rates and instances of violence, we should be pursuing and put on the table. Anything, certainly on the prevention side, I think very important to be taking all the steps that are necessary to stop gun violence from happening in the first place. And the data doesn't lie, and the data will show us what the answers are. So we don't know what we don't know. And I think it's important for our researchers to do what they do. They've been on the front end of telling us the importance and efficacy of red flag laws, the importance and efficacy of safe storage laws and approaches. And all that has now become, in California at least, common sense, and approaches that we have turned into policy that have saved lives and do so day after day. So, we know that 2/3 of mass shootings have a domestic violence connection. What can we do with that? What's the next step? How do we turn that into a policy that leads to prevention? And, other data points where we're seeing trends, but we need to take the next step to connect the dots into a policy that we can implement here in California. We take pride here in California in being on the cutting edge, doing it first, doing it best, showing the other states and the nation, federal government, what is possible when we stand up for common sense, evidence-based gun safety laws. And we want to continue to build that. And our researchers are critical partners, and we look to you to help inform the next slate and set of policies that will keep people safe here in California.
Thank you. I know you were just in Washington, D.C. last week, and California does have one of the strictest gun control safety laws in the nation. But we wonder if there might be some other policies from other states that you feel California should be considering.
Definitely. I think
particularly those that would be supported from bipartisan views, right?
Well, this is a very partisan issue, unfortunately. So I think if we limit ourselves to bipartisan approaches, we'll have a much smaller universe to work from. I wish that weren't true. I don't want that to be true. I think this is keeping our children safe, our communities safe, reducing gun violence, avoiding mass shootings, and the constant, unfortunately, numbers of gun incidents and gun deaths that we see every day should be nonpartisan. It's not, though. If we followed the data and put politics aside, we'd have a assault weapons ban federally and in every state. We'd have a large capacity magazine ban. We'd have universal background checks. We'd have red flag laws in all states operating vigorously to prevent the next gun incident from ever happening. But that's not happening, unfortunately. It's very politicized. It's very partisan. And California does have among the strongest gun laws, gun safety laws in the nation. And as a result, one of the lowest firearm mortality rates. Those things are causal. They're not accidental, happenstance, or even just correlated. They are causal. And if other states did the same, if the federal government did the same, they would have lower firearm mortality rates as well. And we have no pride in authorship. If there's a good idea, no matter where the idea emanates from or who's implemented it first, if it's a good idea, if it can save lives, then we should use it. And that happened this past year. Prime example, the state of New York moved quickly to provide, to put on the books a law that allowed for a pathway to avoid gun manufacturer immunity through the PLACA law at the federal level by setting forth a law that was specifically designed to ensure that there is liability from manufacturers, distributors, and others if they don't take certain steps that are reasonable to keep guns out of the hands of straw purchasers or those who are prohibited, or to have the guns and other weapons stolen. So we did the same. And we put that into place last year with AB 1594. That's now the law of the state of California, a law that emanated originated from New York. Other states also have laws where an individual who is wrestling with mental illness it can put themselves on a prohibited list so that they during an episode or during suicidal ideation won't purchase a gun and will be prohibited from doing so if they seek to. That was something that I proposed a number of years ago as a legislator. Assemblymember Gabriel is bringing that back this year. It's not a new idea in California. It's been done elsewhere. It's saved lives elsewhere. It should save lives here in California as well. So there are many approaches that we should be looking at, reviewing, considering, and when appropriate, implementing here in California. And I think I've come to the conclusion that there's not a lot of brand new ideas. There's some, but there's just ideas that haven't been used in other places and are being successfully implemented elsewhere and need to be scaled and become more widespread so they can touch more lives and help more people.
Thank you so much. And I certainly I've heard of your inspirational story on what brought you into public service. We have a lot of students here. This is my last question. And all very excited to have you as our keynote. What advice do you have for future public health leaders, public policy leaders to help address gun violence in California and across the nation?
I'd say first, don't wait. Don't be shy. Don't think that your time is later. Your time is now. Our young people, our students are certainly the leaders of tomorrow, but you are the leaders of today. You're the leaders of today and tomorrow. You can make an impact now. You don't have to wait for a diploma or a job or some other external indicator of what some people might think is necessary to make a difference. Our students in this country have generally and often led change in colleges and in high schools. I mean, right now we have students in high school marching for their lives. We have students in middle school going, walking out of class as part of climate action strikes and protests to demand that our leaders do more. We have young people declaring Black Lives Matter and really moving us where we need to go. And so your voices are strong. You have power and potency now. You don't need to wait until tomorrow. Your time is now. And own your story, whatever it may be, whatever brings you to this work, whatever motivates you, inspires you, makes you passionate about saving lives and protecting people from gun violence. Tell your story, own it, be your authentic, powerful self, and shake things up and be impatient for change and be unapologetic about stating that the status quo is unacceptable. There is no doubt that it is. And you as young leaders are putting the pressure, rightfully so, on those who have power and influence in their current offices and pushing them and pressing them to do more and to do it faster. And that is the right thing to do. So exercise your power, lean in, push, and demand.
I think I'm joined by many virtual applause and standing ovation for you, Attorney General Rob Bonta. Thank you so much for your leadership. Thank you so much for your compassion and your vision in the hopes of ending gun violence in our California communities. So thank you very much for your time today.
Thank you for having me. Appreciate being with you today. Thanks,
Appreciate
Dr. Bonta.
Thanks. Bye-bye.
Bye.
So we're going to start the next session, which is our panel. And I'd like to introduce my colleague, Dr. Michael Rodriguez, who will moderate our first panel and will give introductions for each of the panelists. Michael Rodriguez the National Collaborative on Gun Violence Research, funded by the Arnold Foundation, that funds the questions in the California Health Industry Survey on gun storage and safety protocols that are being done amongst California's households. So do refer to his bio in the program to learn more about Michael's impactful work on health equity. So with that, I'd like to introduce Michael Rodriguez, I think you're the founding director of the California Alliance for Academics and Communities for Public Health Equity.
Thank you. Thank you so much, Inez. I appreciate your kind introduction, your powerful words that you gave at the beginning, and also appreciate our California Attorney General's important message that he gave, particularly that we're dealing with such a partisan issue, that it is important that we not wait. This is part of a movement, and a movement that impacts everybody, and that requires data to help support the work of the movement. This panel is going to focus on demonstrate issues related to how violence is a epidemic and does not impact populations or subpopulations equally. We'll learn about that from our experts that we are so lucky to have. Our first one is Dr. George Tita. He is a professor of criminology, law and society, and urban planning and public policy at the University of California, Irvine, or as we refer to it as UCI. He directs the Livable Cities Lab, which leverages the academic expertise of UCI faculty and students to engage policymakers and stakeholders around three important issues: providing dignified housing for all, creating and maintaining safe communities, and measuring the social impact of good housing. Dr. Tita's research interests include the study of interpersonal violence with a focus on homicide. He currently co-directs a National Institute of Justice funded project studying the social dynamics of gun violence in Los Angeles. Dr. Tita, you're on.
Well, thank you, Michael. It's a privilege to be with you all this morning. And so many people I know here doing really important work. I would like to talk a little bit about some work that we recently completed, as well as some ongoing work that is related to the issue of rising case fatality rates of gun assaults in California. And our research question is really rather simple. How are the case fatality rates for gun assaults changing over time in California? I should probably define CFR. It's basically conditional on being shot. What is the probability of death? Oh, so we have one paper that was published in JAMA Networks with my colleague from UCLA, Dr. Branningham, and Shelley Young, a postdoc at UC Berkeley, as well as Professor Jennifer Aaron. And we look at this for the entirety of the state of California from 2005 to 2019. And then we have some ongoing work with my colleagues at UCLA, Miguel Quintana Navarrete and Clarissa Iliff, and Craig Uchida, that is taking a look specifically using police data in the city of Los Angeles. So what we're doing in the statewide pattern is combining hospital data on ER inpatient admissions and the Department of Health vital records. And what we know is that gun violence decreased significantly over this period that we're studying from 2005 to 2019. So while, oops, sorry about that. So please forgive me. I'm trying to There we go. Sorry. Okay, sorry about that. I couldn't see my own slides there for a moment. So from 2005 to 2019, we had almost a halving of non-fatal gun assaults from almost 6,800 to 3,800. Over that same time period, gun homicides also declined from 1,900 in 2005 to almost 1,300 in 2019. But the CFR increased nearly linearly from 22.2% to 25.2%. So graphically, it looks like this. We have, almost a linear straight line decline in non-fatal gun assaults. We see our gun homicides are also declining, but the rate of decline, the steepness of the slope here is not the same here. And that results in a CFR that is linearly increasing from 2005 to the period. Now, what becomes difficult really is to say much about the why. The hospital data provides excellent overview of the problem for the entire state. But it really has limited information other than on to the extent of injuries, other than and demographics of the victims. So we don't know. Some people have posited that an increasing CFR is an artifact of the data, and that some hospitals may have changed the coding of events, to which we would likely say, yeah, but not linearly. If we saw an important shift from one year to another, that might explain it. But this is almost linearly changing. We have heard some explanations that are and research that has demonstrated that you can, as more powerful, more lethal firearms enter the market, that you can result in an increase in the CFR. But again, we don't really have much data we have no data from the state level to answer that. Or is there something about the situational dynamics of events changing? Who's involved? Where is it located? What is the motivation? And we think that this is the sort of analysis needed to really unlock the question of why the CFR has changed. So now we're going to look at just the city of Los Angeles using LAPD records. The 2010 to current is publicly available. LAPD provided 05 to 09. These are all events known to the police where a person was struck by gunfire, so assaults, robbery, and fatal and non-fatal events, of course. So we have victim characteristics, we have some event characteristics. And what I can tell you is that from the analysis of Los Angeles only, that the patterns, maybe unsurprisingly, given how large LA is, are not that different. We are seeing a faster decrease in the number of non-fatal shootings than we are fatal shootings. Thus, the CFR rises. So here it is graphically, non-fatal gunshots falling, fatal gunshots falling. And we do have to account for the COVID spike over here, but in terms of a time trend, these are decreasing, and we have an increasing CFR. So we did some statistical analysis using log binomial models, not obviously going to get into the specification and all of the findings here, but just to highlight. Gang-related gun assaults were more 27% more likely to result in death than non-gang. And here we're seeing that the CFR is increasing from 16.8 to 21.2 over the period, and non-gang 13 to 16. So the CFR is increasing across the board of all of the variables that we're looking at, but it's faster in some subcategories. People shot during a drive-by are less likely than non-drive-by shootings, over 40% more likely to survive. And victims shot outdoors were 18% less likely to die than those shot indoors. Again, controlling for all other measures. The CFR is highest for white and Asian Americans here. If you a victim that is white or Asian is more than 50 or 40% more likely to die than a Latino or African American victim. And we know that gun homicide victims are getting older over time. We also know that older victims are more likely to be shot indoors. And this is where, in the limited data that we have here, that I think we're starting to see an important pattern emerge around what we again refer to these spatial or social dynamics of the events. They're coming off the street and into indoors. That suggests to me that the distance is closing between the discharge of the weapon and the distance that projectile travels to striking a victim. And I think that might be one of the reasons that we're seeing the increase in the case fatality rate. There's nothing that we can find that suggests that firearms in Los Angeles are becoming any more lethal than in any other time period. And our policy implications at this point are somewhat limited, and that, like, if these firearms, if more of gun assaults are taking place indoors that are resulting in death, and those firearms weren't brought into the household, but rather accessed during an argument, that might give us some reason to think that if safe storage or limiting easy access within the home may have some implications. That's my 10 minutes, sir. I hope I didn't go over. Thank you.
Thank you, George. Thank you so much for your important data that highlights the very scary phenomenon that suggests the increasing rates and the indoor impacts. We are certainly at a very dangerous place, especially with so many guns in homes as well. Not a coincidence. Our next speaker is Dr. Joan Asarnow. She's professor of psychiatry and clinical child and adolescent psychologist at the David Geffen School of Medicine at UCLA, where she directs the UCLA Center for Trauma-Informed Suicide and Self-Harm Treatment and Prevention. She also leads the UCLA Youth Stress and Mood Program, focusing on suicide prevention and treatment for depression. Dr. Asarnow has led efforts to integrate care for mental health problems within emergency departments and other medical settings, and to develop and spread treatments addressing prevention of youth suicide and suicide attempts. Welcome, Joan.
Good morning. Can everybody hear me? Okay, I'm going to talk about adolescents and young adults, mostly adolescents, and what we can do to prevent harm. So if I can have the next slide. Today, what I'd like to do is to talk a little bit about the scope of the problem. And we've already had a beautiful introduction to that this morning from the Attorney General and my colleagues. And then I'm going to focus on what we can do about it, intervention strategies. And I should say at the start, I'm an intervention researcher and I'm a mom. in addition to being a psychologist. So I'm very, very eager to have us make some changes and make a difference, and then talk about next steps for how we get to improving the situation. Next slide. So let's start with a little bit of data. First of all, these are data from the California Health Interview Survey, source 2021. And as you can see, 12% of our adolescents ages 12 to 18 believe they can get a firearm within 2 days. However, the firearm is usually owned by someone else in the household. 16% of kids understand that there's a firearm in their home, but only 1.6% report owning a firearm themselves. So a substantial number of our kids believe they can get a firearm, and a substantial number of our kids have firearms in their homes. Next slide. Suicide, as our Attorney General told us earlier today, is often most deadly when it's by firearm. And suicide kills more of our kids than any other major medical illness. As you can see, we lose far more kids to suicide than we do to cancer, cardiovascular disease, and HIV/AIDS. It's a pressing issue to do what we can to prevent suicide in our kids. It's the second leading cause of death for all age groups from 10 to 34. Next slide. Lock and protect is something that we developed in order to help limit access to firearms and other dangerous means of suicide and self-harm. And we've used a precision public health strategy in the way we think about it. What we're doing is we're targeting a population, kids who present with suicidal ideation or suicide attempts, and a point of contact, emergency department visits, acute care, primary care, where we find out that a child is at risk. And we intervene at a time where openness to firearm storage and behavior change is expected to be high, with the goal of reducing firearm-related and premature deaths. Decision aids are an important tool, we believe, for targeting this time and place when we may be able to make some changes that are life-saving. And they've been used in a variety of contexts to facilitate complex health-related decisions. And what they do is they identify the decision to be made. What's dangerous in my home? What can I do to reduce the danger from that item? Describe the risks and benefits of the options. Third, assist the reader or the participant thinking through the decision aid in clarifying their personal values, and then activating decision-making. Next slide. So we decided to develop this decision aid, and it builds on the work by Emmy Betts and colleagues in Colorado, developing a decision aid for adults who are suicidal. We then took the tool that Dr. Betts developed and adapted it for parents and caregivers of suicidal and self-harming youth. And in that adaptation, we used a user-centered design process where we interviewed diverse stakeholders, focusing on the decision aid for parents and caregivers of suicidal and self-harming youth. And then at the end, we brought in people who worked in these acute care settings to focus on workflow and how we could get these this decision aid into environments where they could make a difference and save lives. Next slide. So to give you a sense of how we developed it, we interviewed 62 stakeholders, and we included parents of suicidal children, healthcare providers, emergency responders, and we tried to obtain a large proportion of individuals who owned firearms through a complex sampling approach. And I'll start with the take-home message, which is that 96% of the participants who then viewed the decision aid at the end felt that the decision aid was useful, and 91% felt that it gave them enough information to be able to reduce lethal means access like firearms. Next slide. So now let me tell you about the decision aid, Lock and Protect. First of all, we focused on the idea of safe storage. Secondly, we focused it on teenagers and children, their parents and caregivers. And we used the analogy of child-proofing your home when you have a young child in the home. Just like when you have a 2-year-old in the home, you're going to lock up cabinets and put barrier around your pool. When you have a child who's suicidal or depressed or feeling acute stress, you want to think of yourself as having to child-proof your home in the same way so that they can't access something and end up accidentally dead. Children die by accident, even when they don't really want to. And then we included the reminder of the importance of protective supervision. Locking things up isn't enough. If your child's alone, they might find something that could be dangerous. And we reminded parents that others can help. They can't do it alone. They're going to have to think about building a web of support around them, a circle of support around them, so that they can help their child. And because firearms are the most deadly, we began with firearms and proceeded to other methods. Among youth, firearms are the red there in the pediatric suicide deaths and by suicide. And yellow is suffocation. So it's important to remember that a lot of kids die not by firearms, but by suffocation and hanging. Next slide. So this is the first image that people have with Lock and Protect. It is a web-based tool and it's completely, we don't save any information, so there's no HIPAA issues around it. We make it available in the emergency room or in another setting for people to give to parents. And it tends to work out very well because you're interviewing the kid and working with the kid and the parents are often sitting there. So this is something that we can give parents to think through while they're waiting to talk at greater length with their doctor or social worker or whoever is working with them. And the message here is sometimes kids go through tough times when they're stressed, down, alone, and hopeless, when they're upset. They're at risk for suicide and self-harm, and you can protect your child. There are things you can do, and this tool is going to help you to make decisions about how you can do that. Next slide. Then we take them through a series of things. Here's the firearm slide. We start here. Let's talk about firearms. Many people own firearms or live in a place where one may be accessible. Keeping dangerous items like firearms out of reach during this time can save a life. 9 out of 10 people who attempt suicide with a firearm die. Firearms are the most lethal methods of suicide. And then we take them through whether there are firearms in their home. If not, they skip out of that section and go to a section on medication and community hazards. If firearms are in the home, they get information about storage options. I can't go to the next slide. I can't remember if I cut it out. So they go through this sequence of storage options and thinking through how they will store things. And we basically give the message that there are 3 ways to protect your child. 1, you can remove items that could be dangerous. 2, you can lock up items that could be dangerous. And 3, you cannot leave the child alone unprotected without monitoring. And go back to the baby proofing your home concept, which seemed to resonate very well with our families. Next slide. So in conclusion, we've developed Lock and Protect. It's a web-based decision aid that can facilitate lethal means counseling with parents of kids presenting with suicide and self-harm. This tool offers a novel and low resource intensive tool for delivering means safety counseling, and that's a key component of suicide prevention that's often neglected in routine care. Based on data from emergency room survey, only 4% of patients who came in with suicidality got means counseling in their visit. And third, Lock and Protect had high acceptability and can be integrated within workflow in emergency and other care settings with potential for reducing deaths. We have a trial right now going on in Columbia's emergency department where we've been using Lock and Protect with a great deal of acceptance by families and by providers in the ED. The next slide, do I have one? Can't remember if I put one up for questions. Is that it? Okay, thank you.
Thank you so much, Joan, for your so important work, helping us to prevent the suicide and to particularly to engage parents and other folks who are supervising or working with youth, adolescents in particular. So important. I am now happy to present our next presenter, Dr. Nicole Kravitz-Wirtz, who is a population health sociologist and assistant professor at the Violence Prevention Research Program and California Firearm Violence Research Center at UC Davis. Her research focused broadly on the understanding of the social ecology of places in the service of fostering equitable, community-centered policies and practices for improving the health of people and communities who are impacted by violence. Her work has been published in JAMA and many other prominent scientific journals, as well as showcased in major media outlets. Nicole, it's all for you.
Thanks, Michael. And it's really a privilege to be with all of my fellow panelists today and in community with all of you. I'm going to jump right in because I know my time here is short. So most often in the media and also in academia, in times like today, we begin discussions about firearm violence with descriptions and statistics about firearm mortality. And this is understandable, to be sure. Death is arguably the most severe consequence of firearm violence. And of course, this is also in part a function of the lack of widespread, reliable data on consequences other than mortality. But as we all know, death captures only a fraction of the burden of firearm violence, the tip of the iceberg, so to speak. Many people and many more people when it comes to firearm assault suffer non-fatal firearm injuries and survive. The case fatality rate, as we've heard in our last two speakers, for firearm suicide is close to 90%, but for firearm assault, it's only around 20 to 25%, with at least 2 and some estimate closer to 4 survivors treated for non-fatal firearm injuries for every 1 victim of firearm homicide. And then there's all the individuals who may not experience violence firsthand, but who may be witness to firearm violence, or who have heard gunfire in their neighborhood, or who simply live in places in which gun violence is prevalent. Community gun violence is highly geographically and demographically concentrated. And of course, we know this is the result of unjust historical and present-day sociopolitical structures that contribute to inequitable community conditions that increase risk for violence and hamper opportunities for safety and health. National survey research has shown us, for example, that 13% of teens ages 14 to 17 report hearing gunshots or seeing someone shot over their lifetime. In one study examining communities in Chicago highly impacted by structural violence, more than half of youth ages 12 to 15 reported hearing gunshots in the past year, while 73% of young men ages 18 to 26 knew someone who had been the victim of a shooting or a shooting attempt, again, within the past year. Now, we've all seen those maps where gun violence occurs, not unlike the map of St. Louis on this slide, where we inevitably see clusters of dots that represent shooting incidents. But when we're talking about community gun violence, we have to think that that's not just an isolated dot. That's someone's life. And there are people that are part of the network that was attached to that one person. And then cumulatively, if all of those dots are clustered in one neighborhood, what does that mean for the entire ecosystem, which may be experiencing collective forms of trauma? Our team has been interested in exploring in various different ways these broader experiences of violence that ripple across families, as well as entire communities that experience firearm violence, namely secondary experiences of firearm violence and anticipatory concerns about violence in folks' proximal environments and their social networks, regardless of their own direct or witnessed victimization or involvement. So in one line of this work, we analyzed responses from nearly 2,900 California adult participants from the second wave of the California Safety and Wellbeing Survey, or CSAWS, which is a repeated cross-sectional all online survey research project of the California Firearm Violence Research Center at the UC Davis Violence Prevention Research Program. Wave 2 of CSAWS was administered in July of 2020 using a California-specific sample from the probability-based Ipsos knowledge panel. And all of our responses are subsequently weighted to be statistically representative of the adult population of the state. So as you can see here, we ask respondents about 6 broader experiences of violence in their communities and social networks, including things like hearing gunshots in their neighborhoods, encountering a sidewalk memorial to a violent death, and knowing someone at perceived risk of self or other directed harm. We found that these broader experiences of violence are widespread, impacting nearly 2/3 of Californians, with, for example, 40% of adults reporting that in an average week, they encounter at least one sidewalk memorial where someone has died from violence. And then 1 in 5 California adults say that they personally know 1 or more people who have been shot, and 1 in 7 say they know at least 1 person who has shot themselves. We also ask about what we have termed anticipatory concerns about violence. Specifically, are you concerned that anyone you know might physically hurt another person or themselves on purpose? 1 in 5 Californians said they know someone, often a friend or a family member, whom they perceive to be at risk of physically harming themselves or others. And of those, close to a quarter said it was likely or very likely that the person at perceived risk would hurt another person or themselves, respectively, in the next 12 months. And we were particularly interested in these questions because the ability to identify when someone is in crisis or behaving dangerously or exhibiting other warning signs has been recognized as an important component of comprehensive efforts to prevent firearm violence, and several promising strategies are currently predicated on leveraging this type of knowledge, including things like extreme risk protection order policies, or what are called gun violence restraining orders here in California, which provide a judicial pathway for temporarily preventing access to firearms among people whom a judge has deemed to be at elevated risk of self or other directed harm. And so through this line of research and this line of questioning, we also learned that most respondents reported having taken at least some action to reduce the risk of violence by people they perceive to be at risk, including providing resources and asking family or friends to help. However, few people, less than 5%, said that they had acted to reduce access to firearms. And this was despite sizable shares of respondents reporting that the person at perceived risk of violence did indeed have access to a firearm. In another line of this work at the national level, we expanded this research to examine spatially proximate firearm violence exposure, which we defined as living or spending time in settings where gun violence has occurred, regardless of direct or witnessed victimization. And to do this, we used national survey data on youth 15 years of age from the Future of Families and Child Wellbeing study, geospatially linked with incident level data on firearm homicides from the Gun Violence Archive. And here we examined the population prevalence and socio-emotional consequences of living within 1,300 meters of a past year firearm homicide. And just for reference, 1,300 meters is the approximate radius of a census block, which amounts to less than a 1 mile radius, or about a 10-minute walk. So in some of the first general population estimates of the prevalence of spatially proximate firearm homicide exposure, we find that more than 1 in 3 youth experienced at least 1 gun homicide within 13 meters of their home in the past year. 13% of youth experienced 3 or more such incidents. We also find, of course, that this burden was uneven. 56% of Black youth and nearly half of Latinx youth lived within 1,300 meters of a past year firearm homicide, compared with just 17% among white youth. 1 in 4 Black youth and 1 in 5 Latinx youth experienced 3 or more such incidents, compared to less than 1% among white youth. Now, when we looked at cross classifications of race, ethnicity, household poverty status, and neighborhood socioeconomic disinvestment, we see the compounding influence of these social determinants of health inequity. Specifically, we find the chance of experiencing a past year firearm homicide near home is approximately 80% for Black and Latinx youth in high poverty households in high disadvantaged neighborhoods. Of additional note, this analysis showed that racial ethnic inequities and spatially proximate firearm homicide exposure persisted across all cross-classified categories of household poverty status and neighborhood socioeconomic disadvantage, suggesting, unfortunately, that gains in income and residential mobility generate increased, but still unequal protections for Black and Latinx families compared with white counterparts. We also found that rates of past year exposure were high for youth residing in high disadvantaged neighborhoods and relatively low for those in more advantaged neighborhoods, regardless of individual household income. And this finding really adds to mounting research and mounting evidence on the importance of place for health and safety, and suggests that place-based investments in the social, economic, and structural foundations of community life, particularly in structurally marginalized communities, can help reduce the inequitable burden of community firearm violence, even with more limited adjustments to individual level income. So in follow-up work using a propensity score matched sample of youth matched on a number of demographic and social determinants of firearm violence risk, our team has additionally found that these spatially proximate experiences of firearm violence were associated with worse mental health outcomes, specifically increased depression symptoms among youth, and particularly so among the most structurally disadvantaged Black male youth. We also explored factors that may exacerbate risk of poor mental health among the most affected youth, which in this case, as I said, was Black teenage boys from structurally disadvantaged backgrounds who were the most likely to be exposed to gun violence. And here we found that Black boys were also exposed we found that Black boys who were exposed to firearm homicide also had higher prevalence of experiences with police stops and with unjust treatment by police as compared to their counterparts with similar risk of firearm homicide exposure, but who were not actually exposed. And this finding really underscores the interrelated and compounding adverse effects of structural, state-sanctioned, and community gun violence. So just to conclude and sum up here, firearm mortality and even non-fatal firearm injuries capture only a fraction of the societal burden of firearm violence. A large share, perhaps the largest share of the burden of violence can be conceptualized in terms of these secondary experiences, anticipatory concerns about and proximal exposures to violence, rather than the firsthand or direct victimization or involvement. It is these experiences that encompass the collective community-wide trauma, the anticipation, avoidance, fear, community disinvestment, and other life-altering consequences of firearm violence that ripple across entire communities, and disproportionately so across our Black and Brown communities made more vulnerable by structural racism and other past and present systems of marginalization and oppression. So these findings and this conceptualization can help facilitate a reframing or a re-narration in the firearm violence prevention policy and practice space focused on two things. First, the importance of bridging the work of interpersonal firearm violence prevention with deliberate action to challenge the systems of power that create conditions that lead to increased risk of violence in the first place. And second, and importantly, though, in examining community firearm violence through such a structural lens, we must ensure that it's not merely or even primarily a deficit-based discourse that we promote. Rather, theorizing on structural determinants of firearm violence risk must exist in tandem with theorizing on the ways in which young people and communities simultaneously construct meaning of, gain access to, and negotiate for strength-based resources and supports within their community ecosystems to structure spaces of physical and emotional safety and health, even in the context of adverse community experiences, such as community gun violence. Thanks so much.
Thank you, Nicole, for your hard work and your excellent work, underscoring how all the homicides that we read about in newspapers and other kinds of media, internet, etc., are really just the tip of the iceberg. And that we need to focus not just on individuals, but on the environments that shape these behaviors, both social and otherwise. So I look forward to the questions that you and the other experts will be responding to. Speaking of other experts, our next speaker is Dr. Kerith Conron, who is the Blatchford Cooper Distinguished Scholar and Research Director at the UCLA Williams Institute. Her work focuses on documenting and reducing inequities that impact sexual and gender minority populations. She's committed to collaboratively altering the landscape of adversity and opportunity for LGBTQ communities. Her publications appear in American Journal of Public Health and other prominent journals, and her work has also been featured by the New York Times and other prominent newspapers and media outlets. Kerith, it's a pleasure to have you with us.
Thank you so much, Michael. It's an honor to be with everyone today, and I really feel like the new kid on the block in that LGBTQ gun violence prevention work is really at its infancy because we haven't had data, injury prevention data, death certificate data, even good survey data about LGBTQ gun ownership and correlates of risk for gun violence. And so that's why it's been such a wonderful opportunity to be part of this project and to help generate new information about risk of gun violence for LGBTQ adults in the state of California. With that said, I'm going to share with you what I know and some thoughts to move us forward. So in the United States, we know that LGBT adults are less likely than straight adults to have a gun in their home. And we know this through some analysis that we did at Williams Institute using the General Social Survey data. So straight adults, much more likely than LGBT adults to own guns, just like men are more likely than women to own guns, and white people are more likely than people of color to own guns. But we didn't know how this would translate to the state of California, which has greater restrictions on gun ownership and I think cultural attitudes that are less pro-gun than we might see across the whole US. Unfortunately, suicide attempts are much higher among LGBT youth and adults compared to non-LGBTQ counterparts. They are 2 to 4 times greater for youth, LGBT youth and adults, and about 5 to 8 times greater for transgender versus cisgender youth and adults. So suicidality is a significant problem for the LGBTQ plus community. Intimate partner violence has been observed at similar or higher levels among LGBTQ adults. About 1 in 4 LGBTQ adults has experienced intimate partner violence over the course of their lives. It's somewhat higher for bisexual women and transgender adults. LGBT people are disproportionately impacted by hate crimes. In 2016, when I looked at some FBI data on hate crime victimization and attribution, at that time, 4.5% of the US population was LGBT identified, whereas almost 18% of hate crimes reported through the UCRs to the FBI were attributed to anti-LGBT bias. And when I looked at those data more recently in 2019, the patterns were similar. So LGBTQ people experience risk of gun violence from the primary roots that we think about are mental health and distress related to stigma and adversity that are disproportionately experienced by LGBTQ people, intimate partner violence, which LGBTQ people and non-LGBTQ people alike experience. And then the third primary threat comes from outside the community in the form of hate crimes. So this is some information about the LGBTQ population in the state of California used in the California Health Interview Survey data. Using ASCHIS, we estimate that about 2.9 million adults are LGBT identified in the state of California. That's 9.8% of adults. And so while we used to call LGBTQ people a small but vulnerable population, I'm going to say we are not that small and we are growing. And that's really important in terms of thinking about public health and intervention dollars. So guns in California. Using ASCHIS, we see that straight adults, 18.1% are more likely than the LGBT adults to report keeping firearms in the house. Well, if firearms are lethal and where there are guns, is the potential for gun mortality, then this is a positive thing for LGBT people. However, when you look at the number of straight people who report living in a household where there are guns, we're looking at 4.8 million guns. So this is not great. When you are a member of a group that experiences stigma and vulnerability. And so what I'm showing right now is a map produced by the Southern Poverty Law Center that shows us where hate groups were documented in the state of California. And so the concentration of hate groups, whether they're anti-LGBTQ focused or anti-immigrant or anti-religious minority, I left them all up because LGBTQ people are a cross-section of the larger population. And when you look specifically at LGBT adults who are worried about gun victimization and you do a breakout by race ethnicity, you can see that worry about gun victimization, this really, I think, parallels the last presentation, varies a lot by race ethnicity. So we need to think about where do LGBT people live, where do gun owners live across the state, and who's at risk of gun violence in terms of violence directed against the LGBT community from outside the community. I also want to say that these analyses are preliminary, and the trans community is about 1% of the adult California population, but about half of that are LGB. And so in general, when we're looking at results for LGBT adults, they are inclusive of half of trans folks and would change very little if we added that other 0.5% of trans folks to the results. So in the final results for the report that we produce from this work, trans adults will be included in all the slides. So I apologize to members of the audience who are wondering, where the heck are the T's? So I want to show you a little bit of information from California. And this is about, these are adults who report serious psychological distress in the last 30 days as measured by the Kessler-6 inventory. And you can see that almost 1 out of 4 LGBT adults in 2021 was reporting serious psychological distress. Of those people, 14% report that there's a gun in the home. So that's, if you do the math, if you multiply 14% by 23%, you end up with about 3% of LGBT adults in serious psychological distress who have a gun in the home. And that's important when you're thinking about population attributable risk and where to put your resources. Intimate partner violence in the past year, differences by sexual orientation, about 5% of LGBT adults reported physical and sexual victimization by an intimate partner in the last year. It's about twice as high as what we see for straight adults. And then among that group, about 9% of people reporting intimate partner violence who are LGBT also report that they're firearms in the house. And so multiplying the 5% by the 9%, you end up with a smaller percentage of LGBT people at high risk with the gun in the house. So if you're thinking about where to direct your resources, I would say you want to focus on promoting the mental health of LGBT people in terms of promoting safety, acceptance, and support. LGBTQ people have been experiencing higher rates of violence victimization at home and from families, at school, from classmates, in communities, experience harassment and discrimination in public spaces, healthcare settings. These, of course, all have negative consequences for the mental well-being of this population. So that would be a suggestion for primary prevention. I would say in the population at large, we need to screen and treat mental health for LGBTQ and non-LGBTQ people alike. We need to keep guns safely away from children, youth, and adults, to store them safely and to explore technology to improve locks. And so when we created ignition safety locks for cars that included breathalyzers for alcohol, I think that there have got to be ways to improve lock technology to assess the current psychological state of people before they use their own guns or before other people use their guns. We need to promote knowledge about California's red flag law, the gun restraining orders that other panelists have mentioned, while also working to increase police trustworthiness. The police are still a cause of gun mortality in California and elsewhere, and so to rely upon the public to trust the police to disarm other members of the community in order to ensure safety is a big ask until we can improve the trustworthiness and safety of the police themselves with their firearms. We also need to eliminate automatic weapons. I know that's not a hard sell in the state of California. They were used in the Pulse and Club Q massacres. And of course, we need to improve data gathering systems. Death certificates, by and large, in California and elsewhere across the country, do not gather information about sexual orientation and gender identity. Most of our injury surveillance systems also don't gather this info, which it makes very hard to track violence and mortality against LGBTQ people, whether it's self-inflicted or inflicted outside the community. But it makes it sort of hard to move this work forward. I appreciate the time and opportunity to be part of this project and to have access to the data and to be on this panel and to get to learn and listen from everyone who has vast expertise on this particular topic. So thank you.
Thank you so much, Kerith, for your excellent presentation, for underscoring what also the other panelists have spoken about related to the importance of access and different ways to reduce access, and the important population focus on populations, including LGBTQ, but also looking at those who may be experiencing mental health distress, as well as in intimate partner violence relationships, or otherwise known as domestic violence. Extremely important issue, as well as the other ones that you mentioned. Thank you so much. It now gives me great pleasure to introduce our last speaker before we will have some question and answer. This is Dr. Yesenia Pizarro, who is a professor in the School of Criminology and Criminal Justice at Arizona State University. Her research is transdisciplinary and focuses on the proximal and situational factors that result in violence, the processing of violent crime in the criminal justice system, and anti-violent strategies. Her research also explores correctional practices in the United States. She is working on firearms safety and homicide research in the nation and beyond, working with police department agencies and others in addressing urban violence and intimate partner homicide prevention. She's also editor-in-chief of Homicide Studies, an interdisciplinary and international journal. Welcome, Yesenia.
Thank you for having me. It is an honor to be here today to share my research. Today, I will be discussing some ongoing work that I am currently working on with a group of researchers from across the country that examines the risk for intimate partner homicide with a goal of prevention. So when we talk about intimate partner homicide, we know that they comprised about 17% of all the homicides that occur on a yearly basis. However, when we look at the breakdown by gender of who's victimized, we know that women are disproportionately victimized in incidents of intimate partner homicide. We know that when women are killed, approximately 35% of that time they are killed by an intimate partner. We also know in terms of trends that even though intimate partner homicides and in some cases domestic homicides have seen a decrease throughout the years, this is mostly driven by a decrease in the number of men killed in domestic violence intimate partner instances, not so much with women. In fact, we have seen a trend, these incidents trending up. And we also know that the risk varies by race and ethnic group, with some women, particularly Native American and African American women, carrying higher burdens of risk. One of the things that we know about intimate partner homicide is that there's generally a lot of red flags that happen prior to the incident. We know that in approximately 70% of intimate partner homicides involving female victims, there was a history of domestic violence on the by the hands of the individual who killed her. We know that in approximately 75% of the cases involving women perpetrators, that the women kill are more likely to kill individuals who were abusive in a domestic violence scenario. And we know that in the homes of where intimate partner homicide occur, between 25 and 45% of them, there was a history of police reporting to that location for a call of domestic violence prior to the homicide occurring. So prior abuse is one of the biggest risk factors for victimization in an act of intimate partner homicide. We also know, based on some of the seminal work done by Jackie Campbell and colleagues that was published in the American Journal of Public Health in 2003, that there are other important risk factors, some which are listed here. But for the purpose of this presentation, I want to highlight the risk factor of gun ownership. We know, based on her research, that when there is a firearm in the home, the risk increases for an intimate partner homicide by 440%. We know that firearms are the weapon that's mostly used in all homicides, but also in instances of domestic homicide and intimate partner homicide. And this is a particularly important topic. I think it's always been an important topic, but it's particularly hard hitting now, considering some of the recent court decisions regarding DVROs and how we treat domestic violence type restraining orders that involve firearms. So today, I'm going to be briefly talking about the PAIR study, which is the Preventing and Assessing Intimate Partner Homicide Risk. The PAIR study is meant to be a replication and extension of Jackie Campbell's seminal femicide study from 2003, which I previously mentioned. We call it pairs for two reasons. The first reason is because we have paired states. We have paired states that are seemingly opposite from each other, particularly when it comes to firearm regulations, rates of domestic violence and intimate partner homicides, as well as population composition. Our team is a multidisciplinary team of social work, criminologists, nurses, public health, and DV advocacy groups, since we want to make sure that we look at the problem holistically. And one of the things that we've learned is that when it comes to violence against women or just firearm violence in general, the problem is too big for just one discipline to tackle. So we are working across disciplines in in a transdisciplinary fashion in this study. And the second reason why this study is called PAIRS is because we also are looking at survivors of domestic homicide. Like the original study done by Jackie Campbell, we are looking at cases which are individuals who are killed by an intimate partner. And then we are, in the case control approach, we are also looking at controls. Controls are individuals who have been physically abused but survived intimate partner violence. And the reason for this is that we want to shed light into what are the risk factors beyond domestic violence that can increase, that would actually increase the odds for an act of lethal violence to occur. The goal of this study, of this group of studies, is multifold. One of the things that we are looking to do is examine across geographic locations. Today, most of the research comes out of urban environments, but we want to also examine suburban and rural environments. Hence, that's why we're looking at entire states and not just cities. We also are looking to examine marginalized groups, for example, immigrants, refugees, LGBTQ, Indigenous Americans, since a lot of this work, it has been based on females, but also white females per se. And then we are aiming at looking at novel risk factors such as firearm use, ownership, possession. So I want to highlight this because we know that firearms are more likely used in these types of incidents, but we're trying to look at the nuances of the mechanisms of how this plays out and how this plays out in different contexts and in different contexts that are based on the strength of firearm legislation and protection types of initiatives. This has been a monumental task. So we are collecting data. Our three main data pillars are case files. So we are collecting data from ME departments. This is very important because it allows us to see things like, was there any indication of strangulation, which we know is a novel risk factor? We're also looking at police investigation files that have some of the details of the incidents and prior arrest information. And we are also following the cases through the court system so that we can identify what happens to these cases afterwards. In addition, as part of this, we are also doing proxy interviews with surviving next of kin or close friends of the victim so that we can get information that may have not been reported to the police, that might not be in official records. And then finally, we're doing the survey with survivors of domestic violence. Here's just an example of some of our recruitment for the next of kin interviews and a little bit information of the consent validity and how we have validated these instruments. For the purpose of today, because time is limited and we are still in the process of collecting data, I'm just going to talk about some of our police data. To date, we have collected approximately 2,400 homicide files from about 180 police departments. Depending on the state, we're farther along than in others. So for example, in Arizona, Missouri, and Oregon, we're about 98% done with all of our case file data collection. But in places like Texas, we're probably 40% done. So it varies based on states. But I wanted to present some type of findings today. So I pulled from the police data. Of all the police data that we have obtained, we have identified 507 incidents of intimate partner homicide. And to no one's surprise, again, victims of these types of homicides are predominantly female. And again, another thing preliminary that we're finding is that these incidents are more likely to be carried out with a firearm. Again, this is very incongruent with prior research in the area. We plan to explore these trends a lot more. In terms of next steps for the study, we still, like I mentioned, we're still working very diligently to complete these data collection from the case files. I mentioned that's 400 from police reports, but in total we have collected 7,000 when we start looking at ME reports and court reports, that we are going to be merging all that data together. We just pre-tested the control survey, and we're making some tweaks. That's going to be opened up and set in motion in probably the next month. In terms of proxy informants, we're continuing that recruitment. To date, we started in the fall. We have interviewed approximately 12 individuals. Still have to do the data analysis, but the most important thing of next steps is that the most important thing we want to do is to recalibrate and update the danger assessment. For those practitioners that are here, you know that danger assessment is the only risk assessment tool that is currently out there that is intended to actually look at the risk for lethality. And we're hoping that this study allows us to recalibrate and update that risk assessment and identify best practices for prevention, which one of the things we have promised all of our collaborators, particularly our police collaborators, is that once these findings are done, we will offer those risk assessments to them, and we will be offering trainings to them. And of course, then there's the dissemination. I want to conclude. If you have any more questions about the study, please don't hesitate to contact me or contact us through the study. And I always like to end with this quote from one of the survivors, because it reminds me of why we're doing this work. We're doing this work because we don't want we don't want more people to get killed, and we want to do the most we can to prevent. So thank you, and I'm looking forward to your questions.
Thank you so much, Yesenia, for your presentation and your important research and the way in which you translate your research to action. It's so important for the field. And also you're connecting this topic that we're focusing on today of gun violence with these other areas, including intimate partner violence. So extremely important. So I have a few questions here for our panelists, and so we'll begin here. We have one question from Margaret Malloy, who asks, World Health Organization reports that suicide is the #1 cause of death among youth all over the world. Guns are a primary cause of death in these suicides. Self-inflicted deaths by gun suicide are reported in public health statistics, but not included in gun death statistics in our cities. How can we get that changed, even if the categories of gun fatalities are separated by the reporting agencies? We need to see the total numbers in one place to really hold policymakers and the gun industry to account. Joan, any thoughts?
We need to do something to protect our children from firearms. Suicide is a leading cause of death. I couldn't agree with you more.
I have another question then related to Dr. Asarnow's presentation. That is, does the analogy you used of child-proofing result in any pushback from comparing adolescents to infants and toddlers?
That's a really good question. We wondered about that when we did it, but we haven't had pushback. And in fact, it occurred to me because I'm a grandmother of young children, and my kids made me baby-proof my house. And I think that the idea, if this were a universal intervention, where it wasn't this precision public health approach where you're focusing on kids at risk for suicide, I think you would get pushback. But because the kids are dysregulated and you're saying that during this temporary period, when your child's in trouble, don't take chances. Better be cautious than lose your child. And I think that message has been well received, and we did test it. Of course, it's still being tested, but it's a great question. We struggled with it, and and I think because it is linked to suicide, it's more acceptable than it would be in general. But I'm curious what other people think. I really don't know.
Thank you. Thank you so much. George, you had a couple of questions, and I know you responded to them right in the meeting. Did you have anything else that you wanted to add in general to those questions? And can you actually specify the question, please?
I'm sorry, you want me to read the question again that I answered, or?
Yes. Yeah, well, whichever one you'd like to elaborate on. I mean,
somebody did ask whether we would be looking at the relationships or the social ties between the participants of gun homicide, and the answer is absolutely. We want to understand whether or not there were we want to understand any and all precipitating factors that resulted in this violent event, and whether or not those factors have changed over the last decade or so. What we like about this 2010 to current model is not only do we get the change during the pandemic, but we had a blip in homicide levels in the in the mid teens around 2015, where homicide went back up for a bit and then started its retreat again. So we will be able to capture whether or not there were any real changes. I'm received an email while I was on here from someone at NPR asking, that they're hearing that today's violence is over really petty things, unlike violence many years ago. To which I'm shaking my head, because in 1958, Marvin Wolfgang studied homicide in Philadelphia and said that, my words, not his, that most violence is just stupid over trivial things. We have Elijah Anderson coming up with the code of the streets 40 years after Marvin Wolfgang, talking about how so much violence in neighborhoods, it's over respect and very trivial slights. And now we seem to have some folks in law enforcement that are suggesting that back in the olden days, violence was purposeful and you could understand it, but now it's very trivial. And there's just simply no evidence that it's somehow more trivial than it has been in the past.
Thank you, George. Dr. Kravitz-Wirtz, is there any research that indicates how accurately people are able to identify another person who is likely to harm themselves or others?
Yeah, so I saw this question, I was thinking about it. Partly I think this reflects a bit of the paradox of prevention, right? So like when someone is successfully identifying and intervening with someone who's experiencing some kind of crisis or is behaving dangerously, and then the event doesn't occur. So it's a bit challenging to accurately say that someone or how well people are able to identify warning signs, because in the best of scenarios, the bad event doesn't happen, right? What I will say is what we learned about the people who were identified as at perceived risk, large numbers of these, something like 3/4 or more, were individuals who were family members or friends, people who they interacted with at least once a month and oftentimes more than once a month, so multiple times a week. And we've known from past research looking at mass casualty, mass violence events that in retrospect, people often say that they noticed that an individual was acting dangerously or showing warning signs of violence.
Thank you. Thank you so much. Dr. Pizarro, what's the evidence that domestic violence is a learned behavior as well as a situational phenomenon? And is it passed on from one generation to another?
Well, that's a packed question. We do know that research has shown that experiencing child abuse and neglect is related with future violence, particularly towards your intimate partner and your spouse. So there is evidence there, not only in the intimate partner realm, but we do know that there is a relationship between that child abuse and neglect and witnessing domestic violence. So there is evidence to that, and some researchers have found child abuse and neglect in the home is particularly related to factors such as psychological abuse of a spouse and domestic violence.
Great.
Mhm.
Thank you. Thank you so much. I have a numbers, another question from Seth Kaplan. Haven't heard any analysis of financial costs of gun violence from the speakers. We know that this is to any speaker. We know that nearly $570 billion a year is expended on many areas related to gun violence, healthcare rehab, productivity, economic losses, etc. Please address the importance of this topic to reducing gun violence in America. Any brief thoughts?
I'll just say more generally, I think trying to capture some of this broader social burden of violence through economic means, not just sort of the direct costs that are incurred to victims and their families, but to society at large is extremely important in making this a problem that all of us have a stake in solving. We've been, as part of the California Safety and Wellbeing Survey, we've recently asked respondents here in California about their willingness to pay in taxes or donations to prevent a particular amount. I think we say 10% of gun homicides, gun suicides, and mass violence related to firearms. And we see actually that large shares of the population are willing to invest in firearm violence prevention efforts across the board to the tune of anywhere from $100 or so per year per person. To help solve this problem. So I think, more and more people are acknowledging, in part through these population-wide estimates of the burden, the societal burden of violence, that this is something that we all, as I said, have a stake in solving.
Thank you. Thank you so much.
Michael, if I could, real briefly. Sure. There's also the economic costs that a lot of folks don't think about in terms of violence suppresses housing values in the local area. Violence leads to the death of firms in impacted areas. It becomes very difficult, very expensive to hire folks when a neighborhood is going through a surge in violence, and those firms and businesses go out of business. So there are a lot of costs to violence that people should, just because it's not in my backyard in terms of, community violence that we all end up paying for.
And I would like to add here in the context of domestic violence and intimate partner violence, we know that survivors of domestic violence also tend to experience things like PTSD. There's a lot of health, physical and mental health outcomes. There was a recent study that was just talking about something that's never really talked about in how dental work, right? And how that women who are victimized in this often require some of reconstructive work. So that PTSD, that those outcomes do have an effect on, I imagine, on being a productive member of society, like work and stuff like that. We also know that in cases of intimate partner homicide, in approximately 70% of the cases, there is a surviving child, and that child survivors tend to also have outcomes that are not favorable in terms of schooling. Child survivors also are more likely to be experiencing similarly PTSD and other psychological traumas that can in fact have an impact on their life as they become adults. So the effects of gun violence in the community as well as in the home are very far reaching.
How about we go through it past? Right now, we've talked about lots of different issues, important issues, and let's do a circle around you panelists. You've heard from each other speak a bit. Any last comments that you'd like to make? Brief comments so that we can be able to wrap up in a timely way. Go ahead, Kerith.
Questions, I think, have really focused on other potential contributors to violence in society, child maltreatment, and what's driving domestic violence. And while these are important questions and we want to reduce violence and conflict in general, well, the focus on guns here is about the lethality of violence, right? Where there are guns, there are gun deaths. There may be other forms of violence that will have less lethal outcomes. There may be anti-LGBTQ sentiment in the United States and elsewhere, but where there are no guns, there will not be gun-related mortality associated with that anti-LGBTQ sentiment. So I think that's really an important message that I hope comes across through this panel. We can't solve all social problems, but we can make aggression directed towards groups or individuals less lethal. And that, I think, is a key message, at least I'm hoping, comes through this discussion.
Great, thank you. How about thoughts about public relation campaigns? This is a movement. Kathleen Morrison is talking about, this is a movement similar to those launched against big tobacco. Purdue Pharmaceuticals would have any impact on firearms industries, especially those who produce semi-automatic weapons. Also, has anyone done any research in gun violence trends in Mexico in the last 30 years and the concomitant importation of firearms from the US during those same time periods? Any of those issues?
Great question.
It is a great question, and I think, and I have not done any research on the Mexico 30-year past, but I do want to say that as a anti-violence researcher and as a homicide researcher, one of the things that I try to do is educate, and the more educated individuals are about the risks and protective factors and the role that firearms play, as well as the facts about legislations. I think the better these individuals, particularly your youth, are better at lobbying. There are lawmakers. I think the public relations campaign, while that may work, the United States is in a unique position. We have the Second Amendment, and I don't know how much that would even happen, but I just take it on to myself to just educate individuals and, you know, about things that we can do to make our society safer. And it's not necessarily let's get rid of all guns and let's get rid of the Second Amendment. It's more about showing people to be more responsible. And yeah, that's my long-winded answer to that question.
Thank you. What types of community level interventions have been shown to impact the level of community violence? Anybody have any comments about community level interventions and community violence?
Yes. You want to go ahead, Joan?
Want me to go ahead? I was going to say this after Kerith spoke and just the comment just recently too is, you know, when you talk to people around the world, they're shocked by the extent to which we have to worry about firearms. And, you know, there are things that can be done. Norway did something very dramatic where they passed some laws that required people to safely store their firearms, because there are a lot of hunters in northern Norway, and in Norway it's a lot of rural areas, and it really reduced suicide firearm related deaths by 30%. So while we may have trouble legislating some of these laws, the practices can be pushed for. You know, we can argue for these practices, and there are data out there that they work. So I do think that there is some hope. We just have to be strong.
I'll just say, there are a number of really promising community-based violence intervention and prevention programs in both in the community setting and also in hospital settings that leverage the knowledge, the experiential wisdom of credible messengers who have lived experience, who are from the communities that are most impacted by violence. And these haven't received the same level of funding to build the evidence base that even some of the very underfunded work that has been done already and has shown. I'll just on the education piece as well, related to this question, I'll just say we know that education generally alone and awareness building alone is not going to solve the gun violence problem until and unless we have sort of policies and practices in place to support people in their ability to structure their own safety, their own health and well-being. And so, you know, education coupled with policy and practice, particularly community-based, I think intervention and prevention efforts are key here.
Thank you so much, Nicole, and for particularly highlighting the critical importance of community and the voice of community, particularly those community who are most impacted, and how that information is so valuable as we move to address this issue for the long run. I also want to thank the audience for all their questions. I apologize for not being able to get to them all, and want to thank our presenters for their time, for their expertise, and for their insightful comments related to a number of different questions that we've had. We now time to wrap up. You can all applaud in your virtual way, and we will transition back to Dr. Ponce. Thank you so much.
Thank you, Dr. Rodriguez, for moderating the panel on evidence of intersectionality and equity among impacted communities. The big name here is evidence, and this was a remarkable panel of researchers. And you saw that some of the hesitancy, and I think in care and thinking about responses, is because I think they had to really look at the data and not just answering questions just on idealism or questions on again, not based on the data. So this is what we're trying to get at the UCLA Center for Health Policy Research. I thank all the panelists, Dr. Asarnow, Dr. Conron, Dr. Kravitz-Wertz, as well as a newly found researcher, Dr. Jesse Pizarro from Arizona, and Dr. George Tita, who is part of our NCGBR group. We are a little bit running 4 minutes late, but we are going to take a short lunch break, and reconvene at 12:30 if you're in Pacific Coast time. Please adjust according to where you are. We thank you again for your attention, and we'll be right back. We will have a slideshow that will circulate during that time, but please stretch, take a break. It was a lot of information this morning, and I really, please do come back, because there's going to be an exciting panel, and some of the questions that were asked could also be answered in the next panel, which will be public health actions taken to fight gun violence. So thank you for your attention, and see you in 1:30. Hello, everyone. Welcome back. It's now 30 minutes past the hour, and we will enter a very, I think, exciting, provocative panel discussions. And next panel is on looking at public health actions taken to fight gun violence. You've heard in panel 1 some of the evidence, but now it's what can we do about this? And I've just been so thrilled to have met and have worked recently with the moderator of that panel, Mr. Brian Malty, who you'll see soon on the screen and be featured, along with the panelists that he helped identify today to be part of this program. Brian, in all measures, is a nationally recognized leader in gun violence prevention. And it is a movement. It's a movement that spanned his 25-year career. And he's looked at also strategic political campaigns for sensible gun reforms. He has asked me for good data, so always just making sure that the data is backing up some of the formulation of policies and action. And we're so happy that he's back in California, but with Hope and Heal. But he comes from many, many years being with Brady, looking at strategies across other states nationally. So I also want to feature that Brian oversaw the strategic growth of Million Mom March. We heard a lot of references to moms today in our panel, and how that's, the civic action is motivated by people who have been affected by gun violence. So I wanted to give Brian a warm welcome, and again, my sincere thanks in being part of our planning committee for the ER Brown Symposium. So Brian.
Thank you so much, Inez. I really appreciate the warm intro, and very excited to be here on this panel, which we'll talk about in just a second, but definitely wanted to thank the planning committee and the ERB UCLA Symposium for the opportunity to have this panel and this important discussion. And in a moment, I'll have my panelists turn on their cameras and mics to quickly introduce themselves. But first, I just wanted to say a couple words. As somebody like Inez said, has been in the movement for a long time, I've always, in all my 30 years, I've always heard it referred to as a public health approach. But I will say, and for sure myself, that a lot of the emphasis was on one tool, which was policy with a capital P, right? Gun policy, state and federal. Very important, right? We know that policy with a capital P is really important, but I do feel like over the years that other public health approaches have kind of gotten the short shrift in our movement. And I see it changing, and I see it changing for the positive. So I'm very, very happy to kind of talk about this today. One thing I wanted just to remind everybody of, just to make sure we're grounded as well, as what is the public health approach, right? I mean, a lot of folks on here know it, but I think it's good to be reminded of, and this comes directly from the CDC, right? Which is define and monitor the problem, identify the risk and protective factors, develop and test prevention strategies, and assure widespread adoption. So I think that's really important because gun laws, policy with a capital P, is a part of that, but it's not the entire part of it. There's a lot of other tools in the tool belt. So I think it's really important just to recognize that up front. Second of all, what you heard about on the last panel, intersectionality. We're not just talking about mass shootings. We're not just talking about unintentional shootings. We're not just talking about street violence or community violence. We're talking about domestic violence, talking about firearm suicide. We must talk about them all. They're all intersectional. And you heard a lot of the intersectionality parts of all the different forms of gun violence. And also what came up too, and I think we'll get to this today big time, is that the solutions need to involve those who are most impacted. They need to involve community. And it's not talking down to community, it's not talking at community. You don't come with your solutions already in the hopper. You engage communities, what they need. What do they need to see? What do they want to see in terms of solutions? And quite frankly, a lot of great community-based organizations already are working on the solutions. So I just think it's really important for us to be grounded in all of this. And I would also say too, from Hope and Heal Fund perspective, the way we look at our framework is prevention, intervention, trauma healing and aftercare, and gun access. And one thing I'll say before we get to our introductions is, if you're just focused on the lethal means, which is the gun, you're not addressing the root causes of gun violence. And if you're just focused on the root causes of gun violence, but not the most lethal means, you're missing the as people have stated today, the leading cause of death for children and teens in our country. So we must do both. And I think with that, I'm really happy to have our panel, and if they could all just turn on their cameras, and we'll introduce themselves in just a second. I have some new friends, some old friends, so I'm really excited about this panel. This is going to be a lot of fun for me, and I hope it's very informative for all of you. So I'm going to just go around, and then we'll get to our first panelist. But I first wanted to make sure everybody had a quick opportunity in their own words to introduce themselves. So I'm going to start with Andrea, and then go to Fernando, Chris, and then Christian. So Andrea, go ahead.
Thank you, Brian. And I'm very thankful to be a part of this panel this afternoon. For the researchers who spoke before, for my fellow panelists, who some of which I know well. My name is Andrea Welsing, and I'm the director of the Los Angeles County Office of Violence Prevention. Brian, do you want me to talk a little bit about the office right now, or are we waiting for that?
Yeah, we'll get to that big time.
Okay.
Yeah,
Okay.
I appreciate that. Thank you, Andrea. Go ahead, Fernando.
Hi, Fernando Orejón, Executive Director of the Urban Peace Institute in Los Angeles. Happy to be here. Been with Urban Peace for about 15 years. Been working on building out a community-based safety infrastructure. Happy to be here. Good to see friends on this call and colleagues.
Go ahead, Chris.
Chris Kanopke. I'm an assistant professor at the University of Colorado School of Medicine. It's also wonderful to be here and speaking with all of you, and to hear about the wonderful things that are going on in California. I'm in the Division of Cardiology, which is a very long and crazy story in and of itself, but I'm a social worker by background, and have been involved, and I'm affiliated with the Colorado Violence and Injury Prevention Initiative.
Christian.
Yeah, thank you so much for holding this critical conversation, and really feel honored to be a part of the discussion. My name is Christian Heyne. I am the Vice President of Policy and Programs here at Brady, where we work to unite gun owners and non-gun owners, to work across the aisle, to try to address gun violence in all of its forms, to do that through courts, communities, and Congress. And it's a real honor for me to be in this position, in a position that Brian previously held and held really incredibly well. So big shoes to fill, but it's been a journey for me, because Brady was the organization where I found my voice as an advocate when gun violence impacted my life. My parents were shot in an incident in 2005. My dad survived being shot multiple times. My mom was shot and killed with a single bullet to the back. So Brady was the organization where I found my voice as an advocate, and meeting with so many incredible survivors, so many advocates working every day to try to prevent tragedies like ours from happening. And so to find myself here 18 years later in the role that I'm here today, I'm just really excited to join the conversation with so many incredible voices that are on this panel and that were on the previous panel as well. So thanks for having me, Brian.
Thank you, everybody. Well, obviously getting to each of you. And the way we want to run this sort of panel, I know there's a lot of great information before that necessitated PowerPoint slides. I think in this case, we're really looking, I know we'll have a slide or two later, but we really wanted to make this sort of conversational. So basically, the way we're going to do this is I'll take 10 minutes with each of our panelists, ask them a few questions, engage in a conversation. Then at the very end, we'll come back for questions. So please get your questions into the Q&A for each one of the panelists as we move along, and we'll try to get to as many questions as possible. So with that, Andrea, we're gonna have a little chat here. So very excited that you could join us. Before we get started, Andrea, I wanted to check in a little bit. I know the Monterey Park mass shooting in the AAPI community is incredibly horrible and incredibly tragic, but it was also very close to where your offices are at the Office of Violence Prevention. Can you give us an idea of how the community is healing and kind of what the Office of Violence Prevention is doing or has done to kind of help the community heal?
Sure, Brian. And as you mentioned, this incident took place really close to our offices here in Alhambra. We are housed here in Alhambra. The incident took place in Monterey Park. And as you know, the gunman also traveled to Alhambra, but was stopped by Brandon Shea, now lauded as a local hero. And so we are devastated about this mass shooting that took place in Monterey Park here in Los Angeles County, so close to our offices, on the eve of, during Chinese New Year celebration, a time that should have been happy and filled with festivities, and instead experienced this tragic and senseless incident. And so what we have been doing is, working with and coordinating with the city of Monterey Park. There are CBOs in that community that have longstanding, the Department of Mental Health and the Office of Emergency Management. We're there immediately to provide support. We are coordinating our efforts with their efforts, providing support in whichever way we can. We are working on a series of resources to distribute to that community. And to tell you the truth, healing will take time. It is just going to take time. But I think what is helping the most is the ongoing show of support for that community, the vigils, the healing spaces, the mental health support, the assistance center that sprang up immediately after. I want to just say that this loss of lives in Monterey Park and due to gun violence, as well as the daily violence that occurs in our communities here in LA County, all tragic loss of life, the day-to-day violence, mass shooting, lives that are lost at the hands as a result of mass shootings. And it just renews our commitment to work on upstream solutions to prevent violence before it occurs, to invest in intervention to stop further violence when it has occurred, and to support community and individual healing in the aftermath of violence. So thank you for asking about that.
Yeah, no, I'm really appreciative of the work you're all doing. And, sometimes the media starts to move on, right, from communities and focuses on something else in the news. But as you said, we cannot forget about the community. It's going to take a long time to heal, and we need to stay the course with them and make sure they get everything they need. So thank you and OVP folks for the work that you're doing. So let's talk a little bit about your work. I'd love to hear more about kind of how the Office of Violence Prevention addresses gun violence and other forms of violence in Los Angeles County. But can you tell me, this is kind of a no-brainer, but we do see a lot of offices of violence prevention housed in different parts under law enforcement or corrections or things like that. And I'm kind of stating like the easy question, but why was it important to make sure that Office of Violence Prevention was under the Public Health Department, meaning that this is a panel about public health actions to take gun violence? So even though it should be kind of maybe an easy answer for you, there are a lot of offices that are not under public health. And so anyway, if you could elaborate on that and tell us a little bit more about what OVP does.
Absolutely. Thank you, Brian. So when the board established the Office of Violence Prevention, they were intentional in housing this office in the Department of Public Health. And this is important because public health works to address the root causes of violence, really looking at upstream approaches to preventing violence. What are the root causes of violence? And guides a coordinated approach that engages multiple sectors. And I think that was important to the board. And it was also recognition that here in Los Angeles, there are longstanding and have been longstanding efforts to prevent violence across multiple forms of violence for a very long time. And the board understood that lots of really good and important work was being done, but really what we needed was coordination across the multiple types of violence and just in terms of bringing together multiple sectors. So I think that is why they placed it in public health. Public health uses a comprehensive approach that includes prevention, intervention, and healing strategies, like you mentioned. Public health uses data as a foundation to understand risk and protective factors, how frequently violence occurs, where it occurs, trends in violence, who are the victims and who are the perpetrators, and the intersectionality between these things, right? And then public health uses these data to engage stakeholders in the development, implementation, and evaluation of community solutions to prevent violence, promote healing, and restore communities. And then, we evaluate and lift up and try to ensure widespread adoption of evidence-based practices and promising practices as well. The focus of public health is on the health, safety, and well-being of entire populations. A unique aspect of the field is that it strives to provide the maximum benefit to the largest number of people. So that said, and the intentionality of putting it in the Department of Public Health, we're really focused on our mission, let me start with our mission, is to strengthen coordination, capacity, and partnerships to address the root causes of violence and to advance policies and practices that are grounded in race equity to prevent all forms of violence and to promote healing across all communities in LA County. Our values include collaboration, advancing equity and justice, accountability, transparency, and centering the voices of survivors and those most impacted by violence in the design, implementation, and evaluation of violence prevention, intervention, and healing strategies. We currently have an ongoing budget of $12 million and one-time American Rescue Plan funding of $20 million that we hope to roll out very soon to help support violence prevention efforts in LA County. We have 6 implementation priorities that it's part of our focus. And these include things like creating an open data portal, establishing regional violence prevention coalitions, expanding our trauma prevention initiative, which funds street outreach, hospital intervention, community engagement, advancing trauma-informed and healing-centered systems change, implementing crisis response pilot in South LA, and shifting the narrative, which we really believe is critical and important to the work that we do. We are also focused in June 2022, we lifted up a gun violence prevention platform, and we convened our county and community partners to develop a 40-point platform, but we are focused in 2023 on 4 priorities that we believe will shift the needle on gun violence. And this includes, so when you talked about those strategies of prevention, intervention, and healing, and then and talked about gun access, this adds that element to it. We're focused on legislation, continuing to advocate for robust gun safety legislation locally and nationally, social connection and healing services, lifting those up, investing in those, improving awareness and enforcement of gun violence restraining orders in partnership with the courts, community, and law enforcement, and then really focused on school safety and services. And we have a board motion that we're responding to that will really come up with some recommendations in that arena as well.
Thank you. And let me ask you this. You're dealing with a county that accounts for about 1 out of every 4 Californians. And you guys have been in existence for a few years now and have created a really terrific model. What's like the biggest challenge that you see? Obviously, it's a large county. There's unfortunately a lot of impacted communities in the county. What's the biggest challenge right now for you all at the Office of Violence Prevention?
I would say really this aspect of coordination. And it's not just an aspect of coordination across multiple sectors. It's the coordination between multiple forms of violence and really, how do we embrace and develop a regional approach? So LA City, LA County, Long Beach, Pasadena. It's this coordination aspect, which is, it's the intent is there, but the operationalizing of that coordination is very difficult, especially and particularly when our funding sources are so siloed. Our efforts can be siloed. And how do we create a framework where we can all move together towards a collective vision? And I think we are moving there, absolutely. But, resources is one aspect of this, but I think the coordination is really key, because I think there are resources and I think there are services, and we need to better coordinate. And then we need to become more accessible to community in terms of the services and resources that we do offer. And I think there's a huge chasm there that can be there sometimes that really needs to be bridged between what's available, what we hope to provide, and the culturally and linguistically relevant way in which those services are provided, the trauma-informed way in which those services are provided, how we bridge the gap there, I think is one of our biggest challenges, Brian.
Great. And just we've got a few seconds left, but can you tell us about the policies that the county council just put in place or passed? That would be great. And then we'll move on. I know we'll have a lot more questions, but yeah, tell us what happened.
Absolutely. So I'm glad you lifted that up, because we are so thankful for the leadership that is demonstrated by not only here in this department by Dr. Barbara Ferrer, who has been so supportive of the violence prevention efforts and really looking at things with an equity lens and a trauma-informed lens. But we're thankful for the leadership demonstrated by our Los Angeles County Board of Supervisors and their recent actions in response to the mass shooting in the city of Monterey Park. The board recently, just on February 7th, unanimously approved a series of motions to strengthen gun regulations in Los Angeles County and to support and they also made a recent declaration to that gun violence is a public health crisis. So some of those motions include a ban on the sale of .50 caliber guns and ammunitions in unincorporated areas of the county. It also prohibits the possessions of firearms on county property, including for those with concealed carry permits. An additional motion supported Senator Dianne Feinstein's legislation to raise the minimum age to purchase assault weapons from 18 to 21 and to ban the sale, transfer, manufacture, and importation of military-style assault weapons, high-capacity magazines, and other high-capacity ammunition feeding devices. Other measures are aimed at the responsible use of firearms, including the adoption of safe storage practices by gun owners and mandatory possession of liability insurance, as well as the display of warning signs where guns are sold. It also looks at implementing measures to implementing zoning regulations with a 1,000-foot buffer between firearm sellers and child-sensitive areas. Additionally, gun dealers in unincorporated areas of LA County would need to maintain security cameras and a fingerprint log. And then there's a measure that looks at requiring licensed firearm dealers to complete annual training provided by the California Department of Justice. So some of these our county council is assessing the legality of the measures, but there's a lot going on, and we appreciate the tremendous political will and support of our government leaders and to address this issue of gun violence and to include the aspect of healing in those efforts. Thank you, Brian.
Yeah, so it goes fast, doesn't it? The 10 minutes.
Yeah, it does. Thank you.
I know so much to cover. Andrea, thank you so much. We'll be back with you during the Q&A, but want to keep things rolling. So we're going to bring in Fernando Rajon from Urban Peace Institute. There we go. Hey, Fernando. Yeah, man, thanks for joining us. Really appreciate it. First of all, you talked a little bit about Urban Peace Institute. Tell us a little bit more about what you all do.
So for the last 17 years, we worked to implement violence reduction strategies and smart justice solutions to end violence and the impacts of mass incarceration, particularly around communities of color. So our work is focused on developing community safety strategies coupled with justice transformation. So there's an inherent relationship and nexus between the criminal justice system and violence in our communities. So making that nexus of transforming justice and what justice means and how the justice system should serve communities, connecting that with building a community-based public safety infrastructure that allows individuals at the community level to engage and have agency in public safety to address gun violence, proactively utilize their reputations or what we call license to operate in order to transform how safety is seen in LA. And part of our work, a big part of our work has really been to certify intervention workers, street outreach workers across the country, particularly here in LA. We put them through a 144-hour training curriculum, and then across the country, they're shorter trainings, but they focus on the core tenets of street outreach, which interrupt the transmission of violence. Utilizing like a public health frame is interrupting the transmission of violence. And I think given the pandemic, we're all pseudo public health experts. People understand public health a lot differently than we did maybe 4 years ago. But now when you apply that to violence, if violence is a public health issue, how do you interrupt the transmission of violence? How do you inoculate people so that they do not contract violence and they no longer perpetuate it? What are the solutions, as Andrea said, looking at root causes that you have to address in order to bring down the levels of gun violence in our communities?
Oh, great. Thank you, Fernando. And also tell us a little bit about the LA Peace Plan and the idea of creating an office of community safety within the city of Los Angeles, and where you are in the spectrum and how it's going and challenges you're encountering.
So Urban Peace Institute, we're part of the LA Violence Intervention Coalition, which is a coalition of 20 frontline gang intervention agencies that provide services throughout the city. So from the Valley to the Harbor, from the West Side all the way to the East Side. We had a Fund Peacemakers campaign that we've been pushing. We're looking for ARPA funds, supporting OVP getting some of those ARPA funds as well. Pushing to fund the work and build out a community-based infrastructure around safety. The peace plan came together. We got it out to the city before the elections to make sure that it was on the radar of the candidates. And what the peace plan calls for is the initial development of an Office of Community Safety, which is actually in the works right now. Karen Lane has been tasked to be the Deputy Mayor of Community Safety. And so the idea would be in 3 to 4 years to transition into a Department of Community Safety that is on par with LAPD, meaning a parallel community safety infrastructure that has the same power and authority as LAPD. And what we want is when people come to Los Angeles and they think of public safety, they don't just think of law enforcement, they don't think of the sheriffs, they don't just think of LAPD, they think of the community-based infrastructure that has been invested in LA for the past 30 years as it's evolved over decades. So, our vision is to pay peacemakers, more than a living wage, to make sure they have access to benefits, to go from 110 peacemakers to 500. That'll take 1 to 3 years to really develop that level of infrastructure. And as we shrink the impacts of the justice system, as we look at how funds are invested in more punitive approaches to justice, we believe those dollars have to be reinvested in creating a community-based economy and workforce development that circles around safety, healing, and justice. And just like during the pandemic, when intervention workers were tapped to be community health workers, to engage people about wearing masks, to engage people about getting vaccinated, to educate people on the transmission of COVID. That those same principles apply to violence, and they've been doing the same thing. They've been working really hard in LA. We've seen significant declines in violence between 2009 and 2019. We saw violence drop. LA was below 300 homicides for a period of 10 years. Then 2020, like everywhere else in the country, it started to rise. It came down a little bit last year. And so we're really looking forward to working with the city, working with the county and philanthropy to pull together a community-based infrastructure that has a responsibility and agency around safety and to end gun violence.
I appreciate that, Fernando. And I think it's worth calling out too that the city of Richmond has had a model like this for a lot of years with the Office of Neighborhood Safety. Let me ask you, what are the challenges in creating this office, not to create the office, but once the office is done, working alongside law enforcement? What do you think some of the challenges would be, and how do you overcome them?
I mean, I think with law enforcement, there has to be a level of communication. So, for example, the Office of Community Safety, and currently it's the Mayor's Office of Gang Reduction and Youth Development that was under Garcetti. They would be really the kind of intermediary between law enforcement and the intervention workers on the ground. It is important to have law enforcement on board to understand that you have former gang members out there, folks who have been formerly incarcerated, out there engaging people who are potential perpetrators of violence, to engage them to provide alternatives to violence, to lower the rates of gun violence, to lower the likelihood of retaliation. What we found is that when law enforcement alone responds to a gang-related homicide, the likelihood of retaliation is 24%. When intervention and LAPD respond in their separate lanes, it drops down to below 1%, which is significant. The rate drops dramatically when you have a community-based representative there who has license to operate, who's professionally trained to reduce the likelihood of ongoing gun violence. And we've seen that time and time again in LA. The county has been building out their model as well, which is great. And we just need philanthropy to step in as well to say, to give us the ability to innovate and to do the things that maybe county or city contracts won't necessarily pay for, because there are a lot of things when you're addressing with the reality of violence that public dollars aren't necessarily going to address.
Yeah, thank you, Fernando. And we got a couple minutes left. And you talked a little bit about COVID and around the country and how gun homicides have increased everywhere. And we know why that is, right? Credible messengers were kind of switched to frontline workers, right? Doing PPE, a lot of great stuff in their community. Is really, I would assume it's kind of like triage. You got to first things first, right? Couple questions here. How do you, and I think you've kind of answered that, like with more funding, hiring more peacemakers, but how do you, there's a lot of naysayers out there, like whether it's Stockton, whether it's Sacramento, whether it's LA, right? All across the state, across the country, gun homicides have gone up. There are a lot of people say, see, community violence intervention didn't work. We're like not so fast. I'm wondering, like, how do you kind of, and also given the gun sales surge that's happened here in California, across the country, there's more guns out there, more people owning guns. Yeah. How do you kind of make up for lost time in terms of getting those levels of violence down? And can you also just really talk, I know a lot of people know about a lot of the interventions, just the importance of credible messengers and the work that you do?
Yeah, so I'll start with the credible messenger conversation. And there's different credible messenger models. For us with intervention, street outreach, it's folks with lived experience, people that have been there and done that, have the credibility to engage folks and talk them down and to provide alternatives. Many times that law enforcement can't do. Law enforcement may be chasing them, trying to arrest them. Intervention workers are chasing them, but they're not chasing them to arrest them or to enforce any laws. They're there to provide opportunities and to provide alternatives to violence, to talk people down, to support people in their times of need. So having somebody who has that credible background is really essential, and folks need to be valued. I think intervention and street outreach across the country, particularly in LA, were classified as essential workers during the pandemic. They're essential workers, but then also they were emergency personnel. The police chief at the Michael Moore made sure that they were emergency response personnel as well. So there was a dual classification, but they were still getting paid $32,000 a year, right? So that to to the coalition, that's when really the coalition stood up and said, no, like we've been doing this work for years. Violence has come down, and we need to be recognized, and we need to make sure that this is a viable field that can continue as an alternative to just traditional law enforcement practices. Having credible messengers, putting faith, and giving opportunity to folks who have changed their lives is transformative. And it's also a value statement. If this country values, folks that have changed their lives and offer second chances, then they should have the opportunity to give back and provide a different level of safety in our communities. Going to the challenges, I think, Andrea hit it, coordination. It's very, very difficult to do. And we look at it at 3 levels. So one is at the ground level, you have a base of people that are willing, trained, and have the ability to engage folks that, carrying guns. And they're, willing to support, to cross racial lines, to have conversations, to deal with some of the street dynamics. That is essential. Then there is at the public sector level, the bureaucratic level, is to have political will, to have the space and support to do this. Like OVP gets a lot of support from Dr. Ferrer to have the space to be able to do what they need to do. The current mayor, Mayor Bass, has been very supportive of the peace plan and creating an office of community safety. And so we have some leadership there, and supervisors have been supportive. We've been engaging council members, and council members are supportive. Attaining a level of political alignment or political will where there's mission alignment on what the mission is. If the mission is to reduce violence and not incarcerate our way out of this, then we have to create the political space in order to do it. Now, where UPI comes in is really that in between, is to make sure people are trained, that there's communication. Sometimes it's translation between community and public leaders, and ensuring that we stay mission aligned. We're not running for office every 4 years. What we're doing is we're really focused on a strategy. Whoever's in charge, whoever's in office, is that we want to partner, work with them to ensure that we are building out a community-based safety infrastructure that will transcend and redefine what safety really means, because the mere enforcement of laws alone does not generate safety. Safety is people's perception of safety, how they feel, do they have economic viability? There are many questions and indicators that we have to look at. We can't just look at shots fired and homicides. We also have to look at public health outcomes, right? And this is the audience that understands that maybe more than anybody. So for us, that's part of our mission is to build out this new type of public safety that transcends but has all the harms that has been done in the past in order to create a future where people can feel safe, people can have access to opportunity, and address many of the issues that a lot of folks have an over-reliance on law enforcement for. Let law enforcement deal with the violence, or let them deal with the crimes and that other stuff. Also build out a community infrastructure that allows community to impact some of that as well.
Well said, Fernando. We'll leave it there because we'll move on, but we'll be back with you. Thank you so much. Really appreciate your words, and looking forward to the Q&A with you. Now we'll keep moving on. I know I'm running over a little bit, but we'll get over to Christian Heyne from Brady United.
Thanks so much, Brian. And I can listen to Fernando and talk about this all day. That was really impressive. And I'm just so thankful to the innovative work that's being done on the ground, and happy to talk to you a little bit about how we try to complement some of that work with our community engagement as well.
Absolutely. And one of the things, obviously, as you mentioned, I was at Brady for a long time, and we always talk about where the guns come from and how they get into community. But can you talk a little bit about how easy it is for our young people to access guns on the street, and what you guys are doing about it?
Yeah, thanks. I think that question is one that we at Brady have been trying to tackle and ask, intentionally. One of the ways that I try to describe it is how really the supply side of firearms in communities is the other side of the coin to the community engagement that we just heard such incredible work and investment is being done, and it needs a lot more investment so that they can continue the incredible work, right? If you think about it in terms of addressing those root causes and taking that public health approach in the ways in which Urban Peace Institute and others are doing, you can look at that as trying to focus on demand, right? How do we make it so that people don't have to pick up the firearm? How do we stop exacerbating those root causes that are creating cycles of violence and having generational impact? And the other sort of thing that we know also is a truth is that in too many communities, it's easier to find a gun than it is to find fresh produce. That being said, from all of the research that we have seen and the data that has been available over the years, it's a really, really small number of irresponsible and negligent gun dealers that are vastly flooding the markets with those firearms. We know that somewhere around 5% of gun dealers are responsible for around 90% of crime guns. So when we talk about, and crime guns for the sake of the conversation is any gun that is found in a commission of a crime. So we know that there are a very small number of people vastly responsible for flooding communities with guns, and also that they are continuing to operate with impunity, because for so long our law enforcement approach has been focused on who pulled the trigger. We're not asking the question enough, where did the gun come from in the first place? And so there are people who are oftentimes from what we have seen. If you look, we have a resource called the Gun Store Transparency Project, where we have, using the Freedom of Information Act, received tens of thousands of pages of inspection reports that ATF has looked into individual gun dealers. We have publicly made those available, so you can search by county or zip code and see exactly what the violations have been. But when you look at that, you see that these irresponsible and negligent dealers are operating outside of the communities that are most impacted by gun violence. They are usually in affluent and in suburban areas that, and even in spite of being found to have these serious violations, continue to operate and continue to profit off of gun violence in communities of color that are disproportionately impacted. So what we're trying to do is fix that. How do we prevent the theft and straw purchase of firearms? How do we do this creatively? How do we work with communities to do this in a smart way? And how do we use that courts communities approach to have an impact there?
So if you're, and again, having gone to a lot of communities in my 7 years at Hope and Heal Fund, when you bring up the point about easy gun access, and I think there's a lot of groups who are doing great work. They're attacking the root causes. They recognize the lethality of a firearm. But when you start talking about where the guns come from, sometimes it's just the immediate surrounding area. Like there's that liquor store, there's that van that pulls up. But once you start walking it back a little bit, what I've seen is you really gain people's attention. What do you tell a community in terms of kind of what they should do? What's like the first step they need in terms of dealing with the supply side here? They get a crime gun trace report. Do they go to the law enforcement officials? If they get that information, what do they do with it? I think that's the piece that I'm interested in, is how you kind of break it down a little bit in terms of what a community would do.
Yeah, I think that's exactly right. I mean, I think there is no reason why every time a gun is used in the commission of a crime, especially in the ways where they are dramatically impacting communities, we shouldn't be asking the question where the guns came from. And culturally, I think this is one of the most important things. We often are saying there's no better disinfectant than sunshine, right? And we need to shine a light on the reality that, look, the vast majority of gun dealers are going above the letter of the law. The vast majority, that 90% coming from 5%, if you think about it the other way, is that 95% of gun dealers are going above the letter of the law to make sure that they aren't having this kind of dramatic impact on in surrounding areas, and they want to just have a business. And so we need to have the better information to understand who is that 5% and how are the ways that we can hold them accountable. Maybe it's poor business practices that are allowing guns to be stolen, that are or maybe it's a lack of training that is permitting or making straw purchasing very easy. But what we do know is that if you just do a little bit more, you can prevent that theft of straw purchase. It doesn't require a ton. Locking up your inventory at night, training your staff to be able to identify a straw purchase, having cameras to oversee these transactions. All of these layers create an environment to which we can have a dramatic impact on that flow of illegal guns. But it starts with, and it's only going to happen if the community is calling on that response, and frankly, calling on it to law enforcement, right? As law enforcement talks about, and as the world is talking about ways in which we can reimagine policing, this is a prime example of, rather than a focus, historically that is on over incarceration and over policing in communities already disproportionately impacted by gun violence. Instead, we can push law enforcement to go after these irresponsible, negligent dealers, shut down any business practices that are intentionally fueling the crime gun market, go and work to make sure that practices change so that some of these other dealers can remain open, but maybe they're not as easy of a target. And if we do those things, we can have a dramatic impact, because we also know that more than 50% of guns that are used in crime have a time to crime of around 3 years, and that's the national average. So this isn't a problem that we can't tackle. It's something we can have a tangible impact on, but it starts with the community calling on innovative approaches.
Absolutely, and as I've always said, and we've probably talked about, is we always say to folks, guns don't fall from the sky. They are systematically trafficked for profit by individuals and others. So this is a really important aspect of the work. Like we said, you could focus just on the root causes, but you're not dealing with lethality. Lethality is just easy access to firearms on the streets. But let's also talk for just a second too about some of the other work that you're all doing at Brady. We also know that there's easy gun access out on the streets, right? There's also easy access to guns in the home, especially with the gun sale surge that we've seen here across California, across the country. More homes now have guns in them. We also know that a lot of first-time buyers here in California. A study done by UC Davis showed, I believe, is around 40% of all the gun sales during the COVID period were first-time gun buyers, and half of those are women, and I think around a quarter or so were people of color. So this really makes a inherent problem, chronic problem, potentially worse. Tell me what you guys are doing at Brady in terms of that sort of education around safe storage of firearms.
Yeah, absolutely. And you hit the nail on the head. I mean, I think sometimes we don't talk about, and when we're talking about a public health approach, we can't ignore this, right? Is where exactly the problem is the worst, so that we can have the most impact potentially by focusing on where, those disproportionate impacts are happening. And I think, when we talk about safe storage, there's a huge impact you can have on firearm suicide, which accounts for 3 out of 5 gun deaths in America, right? And the overwhelming number of unintentional shootings that happen within the home because of access to guns. There's no. We as a country now, the largest cause of death in this country of American youth is. So we know that the most effective strategy to prevent that from happening is to make sure that those guns are responsibly stored. We have a program here that we run with the Ad Council called End Family Fire that aims to do that. And a big part of it is trying to push the culture around these discussions in a way that we are talking directly to gun owners to make sure that they understand the impact that responsible and safe storage can have in the home. Family fire itself is a shooting involving an improperly stored or misused firearm in the home that results in death or injury. And we have worked on a number of ads focusing on these different buckets of where we know gun violence is happening regularly. So unintentional shootings, firearm suicide, particularly with the veteran community. And we're also now looking at and talking about what kind of impact does an unsecured firearm have outside the home when people are able to access them as well. So our hope is by naming these kinds of tragedies, by really focusing on messaging that works directly to gun owners, because so many people are bringing firearms into the home to protect their families and may not know that by bringing that gun in the home, especially if it's unsecured, you are increasing the likelihood that you and your family are going to be shot. So there's simple steps you can take to prevent that from happening. And so our campaign is really aimed at taking that cultural approach to do exactly that.
Christian, that was fantastic. Really appreciate that. Again, the 10 minutes goes by super fast. We could talk about this all day. We'll have you back for Q&A, but thank you. And now we'll turn over to Chris Konopke. Chris, you there?
I'm here. Hello.
Hey. How are you?
Doing well, you?
Yeah, thanks for joining us. I really appreciate it. We're going to talk, I know a little bit about farm suicide, some of the stuff that you're working on. And I will say this is typically the one of the most forgotten areas of gun deaths in our country. And so I really appreciate your focus in this area. Tell me a little bit about your overall work and kind of what brought you to that work and why suicide prevention.
Absolutely. And I just want to quickly reiterate that I appreciate the opportunity to be here, as California is undeniably a leader in a lot of what we're talking about here, both in suicide prevention and in firearm injury prevention more broadly. And I hope it can inform what our comparatively new statewide Office of Gun Violence Prevention can do here in Colorado. As to why I got into this, as Christian pointed out earlier, that firearm suicide is a widespread problem. He said 3 out of 5 nationally. In Colorado, it's more than that, and that's true, I think, in a lot of states. So that that's something that deserves to be sort of paid attention to when suicide is such a prevalent issue, both in terms of death and disability. I could also say that the easy answer as to why I got into this is Emmy Betts, who, if anybody on here doesn't know her, you're missing out. So I hope that you get the chance to meet and work with her. She's an ER doctor and researcher here at the University of Colorado who leads and has put together a really incredible community of people who are just interested in having an impact on violence and injury prevention, particularly around firearms. The longer, more complicated answer, I won't make it too long, but is really just a statement about how ubiquitous gun violence is. These kinds of things are true of everybody here, that none of these things make me special. Like I've had personal losses to suicide. I've lived in many communities that have been impacted by public mass shootings. My partner she's become something of a violence or a public mass shooting postvention expert by virtue of being a school mental health administrator. And so it's just to say it's everywhere, it seems a little over the top, but it kind of isn't. More to the point, though, I was a therapist in a former life, and I saw the value of lethal means counseling as I was, working with clients who were in various stages of crisis, and how lethal means counseling and safety planning kind of work together, including how tools that are introduced into those conversations can lead to different outcomes of the conversation itself, which I think I'll delve into more deeply here in a minute. But the truth is that, all of these things kind of work together, and that gun violence, of course, looks like a lot of different things that need a lot of different solutions.
Yeah, I appreciate that, Chris. And can also, so you have a lot of focus on firearm suicide prevention, and I'm just curious from your perch, why historically in the gun violence prevention movement there's been less focus on prevention of these types of gun deaths and others, because I know one of the things that certainly jumps to mind is what people read in the news, and you're not, for lots of reasons, going to be reading about every firearm suicide death or whether a firearm was actually used. And I also, I think one of the things that I was kind of harping on earlier is that policy with a capital P has its place. But if you're talking about, in a lot of senses with firearm suicide, right, you're talking about the person with the key to the lock. So really legislation has a little bit more limited view on that. And there's the whole voluntary aspect of this. I don't want to steal your thunder, but I'm just kind of curious about why you see this work not to the level, especially when it's nationally 3 out of 5 gun deaths. Why isn't there more focus on it from your end? And you talk about lethal means counseling, and I know we'll get into this in a second, some of the voluntary efforts. Yeah. Why is that so important, especially when you're looking at other tools in the tool belt besides policy.
No, absolutely. And I do think that suicide is a hard topic for us to even psychologically consider, right? It's a particularly, and so that affects everybody who's involved in the conversation, whether that's policymakers or scientists or anybody else, right? It's a dark and it's icky topic. I mean, even people who like action or horror movies can be disturbed by a graphic depiction of suicide in the media, right? And even then, I go back to when I was teaching social work students at both University of Denver and at USC. We have a hard time teaching future social workers and psychologists to reliably ask direct questions of their clients who they think might be at risk, right? And that generally has to do with their own discomfort about the topic, and then some combination of personal and professional liability concerns. But the same dynamics are likely to be at play when you're talking about suicide prevention in the public health and media spheres. And then there's also, sort of this seeming sense, and it's a misperception that suicide isn't preventable, right? That somebody who is at risk of suicide is destined in some way to die by suicide, and that plainly speaking isn't true. More than 90% of people who survive a suicide attempt don't go on to die by a suicide attempt. They will go on to die of heart disease or cancer or any of the other things that people eventually die of, but not suicide. And I mean, there's certainly cases where there's people who are chronically experience crisis, but again, they're not the majority of people. And so I think that misperception, broadly speaking, not necessarily within the people here, but broadly speaking, can lead to sort of an underemphasis on, well, this is an issue that really isn't targetable. It isn't a needle that we can move. And as a mental health professional, I'll just say out loud that I don't think that's true. All of this is really unfortunate because suicide is actually one of those topics where there's comparatively broad agreement across the political spectrum, and it provides us an opportunity to engage the gun-owning community in solutions in ways that they really might otherwise have been reticent to do so.
I really appreciate that. There's a lot of information out there, even by really highly educated people as well, who don't read the suicide, don't read it correctly, that they'll find another way, and that it's, if they don't use the gun, they'll use something else. So I really appreciate those powerful stats. And I think I'd love to hear more about your work. I know you're going to throw up a slide, so I'll give you.
I can. I feel odd being the only person who has a slide.
Oh, it's just one slide. It's all.
And it is one slide, and it's just a picture of a website. Like I could have called up the website too, but what I'm showing here is one of our sort of newer developed ideas, and we've had some grants to look at how these have been developed and develop a toolkit for other states that are developing these. But what I'm showing you here is the Colorado firearm storage map, and so that everybody knows, there are roughly a dozen or so states now have those. Colorado was the first. We'll take our credit for that, but there are other states that have built them since then. I know that there's some efforts in California. I'm not sure where they are, but at the very least, that these are out there. So what these are meant to be are sort of freely available resources where someone who normally has firearms in the home, but who has someone in the home who's in crisis, or maybe they're moving and they're showing their house, or they're going on an extended vacation or something that is less sort of crisis prone, but they could locate somewhere where they could safely and legally store their firearms out of their house. Colorado has some odd transfer laws, which don't all apply in California. But since these are all law enforcement agencies or federally licensed firearm dealers, they meet all ATF and other requirements. And that's all to say, sort of what its utility is on its face. The map itself is useful in that way, but I also think it creates things that are useful well beyond it. So it's an artifact that can be used to facilitate all kinds of conversations for people who are in crisis or otherwise need support. But the process of creating the map, I think itself is just as useful, because it creates an opportunity, again, to meaningfully and intentionally involve the firearms community in suicide and firearm injury and death prevention. And one thing that I do think it's easy to overlook, and although Christian alluded to it earlier, and where Brady and others have been leaders in this area, but it's easy to overlook the ways in which the majority of responsible firearm businesses are engaged in preventing unsafe firearms access, which both necessarily occurs within the walls of their businesses, and as part of being part of a community, whether that means the community of the geographic location that they live in, or the community of people who are their patrons, or both. I think it's sort of notable that they want to be part of that sort of. They want to do good in those ways. And there are things that anyone who's interested in reducing gun violence can learn from them, from having been on their aspect at the front lines. One of the things that we found in interviews that we did with people who participated in these maps is that this is a great way to be involved because they universally want to be part of the solution. I cannot think of a firearms store owner who, again, like these are people who I share very little with personally, right? But who I would talk to me and say, you know, I have some reservations about what I could do. Like there's some legal concerns and some liability issues that I would need to work out with the ATF and with my insurance provider. But if you're just asking me if I want to do this, absolutely I do. I want to be able to provide a place where people can store firearms if they're not in a good place, because I don't want bad things to happen. And I also don't want the heat that it brings on the firearms owning community by having these things that then get used in ways that I would not support. The ways in which the map itself can support lethal means counseling in sort of in a clinical context. So if somebody was coming to me or somebody like me, I think is also interesting and useful beyond what the map is, because I could envision a circumstance where if I was talking to a client and that person said, you know, I have guns in the house and I'm not in a great place, and we're putting together a plan for getting them support and kind of moving, what the plan was moving through with the rest of their life. And I'd say, like, so here's some places that we know that we could get your guns to, and they'd be safe. You'd be able to, access them whenever you felt like things were okay. And we'd look at it, and we'd sort of weigh the pros and cons of each one. And eventually they'd probably say, I think I'd rather call my brother, my friend, my pastor, my rabbi, my whoever, right? Which I also think is a victory as a social worker, right? Like as somebody who wants to involve others in the care of people who are in crisis. And I think that that's as big a victory as anything, both clinically and from the standpoint of suicide prevention.
Chris, I really appreciate that, and great stuff here. I know, like you said, other states are doing this as well. And it also just, I would love just before we move on to Q&A, one of the things I've encountered with some of the gun owners is that, could be a veteran buddy, right? It could be your hunting buddies, right? And seems to be, this is more anecdotal on my side, maybe you could put some numbers on it, but really reticent to talk to their friend who's in crisis. Maybe there's been a lot of drinking, they're not answering, they're very despondent. But somehow I've heard over and over again that if I address it with him, let's just say him for the time being, then he's really going to, kill himself. So the idea too is to understand, right, is part of lethal means counseling is not just the person in front of you, the frontline intermediary, it's also friends, buddies, socio-ecological thing, it's family, it's friends. They need options though. So here are options. But also, can you talk just a little bit about kind of how to break the ice and how to get friends and family and others to say, look, why don't I hold your weapons for a while?
Yeah. No, that's almost sort of that's the white whale, right? That's the white whale of suicide prevention, particularly as it pertains to firearms, would be, teaching people that, to ask a question in a really direct and honest and having a genuine sense of curiosity about that person is really what we need in terms of getting people access to care, reducing access to lethal means, things like that. So I think that the answer, such as it is to try to get people to be comfortable with the idea of so you can lay out with somebody if you notice that things don't seem to be right with them, to do that. What I'll throw in, and hopefully this is very quick, as an anecdote from others who've been involved, and some of the people on here I know from the GVRO and ERPO work that I've been involved with. But when folks have gone out and done community talks about GVROs, one of the things that happens is people will come to argue with them, right? And sometimes after those talks, especially if the person is sort of a skilled public health communicator, many of you probably know who I'm talking about already, but the members of the community who came to argue with them will come up to them afterwards and say, I was here to tell you how wrong you were, but what you told me makes sense, because all of us in the gun owning community, who've had guns through our families generation after generation, we've all had somebody who, was in crisis one way or another. Their partner was leaving them, they lost their job, they were drinking too much, all these things were going on. And there was the whisper campaign that went on, within our family about, well, what can we do? We're worried about this person, and we'd like to take guns out of the equation because we worry what they might do in their darkest moment. And what GVROs do is give the police an option or them an option to petition for it. But this is also sort of part of the same conversation. Like, what if you just laid that out for that person and you said, hey, you've got all these things going on. I could totally see why you would be in a dark place right now. Would you mind if we took the gun somewhere else, even, like while we just figured some stuff out, and just be there in that conversation?
Yeah, and I think it's like you said, it's all the pieces to the puzzle. The gun violence restraining orders or ERPOs might figure in, but maybe for some that's kind of the pulling the ripcord on the parachute, right?
Yeah.
And these other things will be like, oh, well, my family or friends or my hunting buddies or veteran buddies want to hold the firearm. So I so appreciate the work that you're doing and the mapping, and it was really great to meet you last week, and I know we'll be staying in touch. But at this point, I would like to invite back in all the panelists, as we're going to go through a little bit of Q&A. We've got about 10 minutes, and I see everybody's almost on. There we go. Thank you, everybody. Appreciate. I mean, the time flies. Like, it felt like 2 minutes. So I really appreciate everybody being concise. And we have a few questions, and I'm more than happy just to throw it out there for anybody who wants to jump into it. So we have a question here: is what effect would police solving more murders and getting convictions have on the rate of gun violence? So I don't know if that, Fernando, is that something you want to tackle or comment on?
Yeah, I mean, you look at clearance rates. So for example, in Watts, there was a few years ago, there was a clearance rate of something like 90%. I mean, it was really, really high. That they were, arresting, people who were perpetrators. But that didn't happen in a vacuum, meaning, so when you have the style of policing through the community safety partnership changed, LAPD's approach in Watts. So officers that are part of the community safety partnership program engaged residents proactively, engaged in what we call relationship-based policing, where it wasn't just focused on punitive. And that was also coupled with other strategies, community-based strategies, where gang intervention workers, were engaging, active gang members to ensure that violence was low as well. When the level of trust goes up and communities believe that law enforcement are there to protect them, and there's a respect for dignity, you'll see more convictions. You'll see community members will be more willing to say, hey, come get this person. The law enforcement's not going to come in, kick the door down, throw grandma on the floor, scare the kids, and go in and arrest somebody. They're going to have more access to that person because the community is going to say, yeah, this person needs to go. They're out here crazy, causing havoc. It's also too, there's part of the dominant narrative is that we can arrest our way out of violence. And that's a misnomer. You cannot arrest your way out of violence. 1984, and there's still people around here that I talk to every day that talked about the Olympics, and every weekend, if you were labeled a gang member, you were going to jail. They put 1,500 people in jail every weekend because the Olympics were here and they couldn't have any gang violence. But look what they're doing in El Salvador. They locked up 53,000 people. That's very short-sighted. Violence may go down, it may calm things down for a while, but longer term, it does not pay dividends, and you do not see an increase overall in safety long term. And so when we're talking about solutions, we have to be proactive and look at root causes and invest in infrastructure that creates a different type of safety that and it provides opportunities for people.
Thank you, Fernando. I appreciate that. We're going to try to get as many questions as possible here in the last few minutes. So this may be for Chris or Andrea, but anybody is welcome to answer it. The question is, do you have any experience with a teen mental health first aid program? It teaches teens in 10 to 12th grade, 15 to 18 years of age, how to identify, understand, and respond to signs of mental health and substance abuse challenges among friends and peers. I wonder how it has impacted gun violence amongst teens. So I think the larger question is, are we getting to the younger people and addressing their mental health needs? So Chris or Andrea, do you want to go ahead, Chris?
I'd be interested to hear what Andrea has to say. I'll just say very quickly that so mental health first aid, it's a thing with adults too. I think that the teen version actually came after the adult mental health first aid, and it's a really good and interesting idea from a social emotional education standpoint, because it does teach some of these sort of identification and bystander skills to kids. And then in Colorado, we have something called Safe to Tell, where kids can like anonymously report to, like, they can text, they can call, they can do all this other stuff, and it gets abused a lot of the time, but like administrators sort of figure that out and kind of work through it. But it teaches some of those skills. And the problem with using it with adults is that, you know, kids you can sort of reliably find in one place, and that's at school. Whereas with adults, they're in workplaces, maybe, right? But like there aren't as few localized places in which to deliver a curriculum. But otherwise, I think that they have some really interesting ideas.
So I just want to quickly add, because I think this is one element of, so two ways. We don't have that now, right? We don't have that now, but certainly I think with the American Rescue Plan dollars, part of that, you know, we sort of have a project design that includes funding and investing in young people, and looking at how youth programs and services, what those should look like. And I think for that, and also for our school safety board motion, when we're actually looking at what does school safety look like, we coming up with the definition of school safety in its broadest sense, looking at schools not as an isolated element, but how does that interface with the community? We are going to talk to the young people. So this is to what Fernando, you were saying earlier, what we all know and what we believe here is that we don't come up with the solutions in and by ourselves. Like, we talk to the people most impacted. And so I think as we roll out these two things, both the American Rescue Plan dollars, the funding for youth, also the school safety board motion, we're going to engage youth in understanding the issues around safety, the gaps, but also what they envision as the solutions, because they need to be at the table and in the conversation about you know, safety and violence prevention. And so we absolutely want to engage. And I imagine that we will see things like, you know, how are youth engaged and involved in these efforts? So more to come there.
Yeah, thank you, Andrea. And what I always hear last 7 years at Open Heels, don't talk about us without us. That could be young people, that could be different populations, back to communities. And I think that is something incredibly important. Dr. George Tita chimed in, who is, of course, presenting on one of the previous panels. And Christian, I wanted you to get your reactions to this. And Dr. Tita says he certainly agrees with the systematic trafficking of guns bought from dealers, but also with Dr. Tita and his work in LA suggests that guns also flow through theft from homes, vehicles, etc. So safe, secure storage would also reduce the flow of stolen firearms from homes. That kind of marries your two your two programs or efforts together. But I just wondered if you wanted to add in anything on that.
No, it's a really critical and important point. I mean, we even know just from, you know, and mass shootings account for a small part of gun violence in this country, but it also is a kind of gun violence that occurs nowhere else in the industrialized world, right? And 76% of school shootings are facilitated by kids that have access to unsecured or unsupervised guns in the home alone. So you take that, you take the additional risk of theft and breaking into cars, into homes, and how that flows. And frankly, how gun dealers, a lot of guns are taken out of, if gun dealers aren't locking up their inventories at night, it's also having a massive impact. So we should be asking the question, right? I mean, I think the bottom line is not only is it important to lock up your guns because you have a responsibility as a gun owner, and that's something that I think most gun owners we work with and talk with, they feel that responsibility as a part of their work as well. But we also need to be asking that the question even earlier when we're talking about solving crime. Law enforcement should be solving the crime of who's flooding communities with firearms as well. And if they're not asking that question, they're only worried about who pulled the trigger. They're not getting at the root causes, and they're missing the flow of illegal guns as well. we need to have a more comprehensive view at addressing gun violence on the whole.
Great. And I think, well, to keep everything moving on time, we'll probably leave it right there. There are a few other questions. I'm really sorry we couldn't get to all of them. I just wanted to, take this opportunity to thank Chris, Andrea, Fernando, and Christian for being a part of this panel. Like I said, we could have be talking for 2 days, but I don't think it would be paying attention after that. But there's just so much to cover, and I really appreciate sort of the public health lens that you all brought to this. I also, again, feel strongly that it's so important that you're all dealing with credible messengers and engaging those who are the most impacted, because without that, it's just a bunch of people in a room making decisions for others. So with that, Ninez, I will turn it back over to you. Again, thank you everybody for the questions, and thank you panel. Great job. Appreciative.
Thank you. Thank you so much, Brian. It's a deep gratitude to all the panelists. I love the public health approach. What Fernando said about we need an inoculation for gun violence, and you also can't incarcerate our way out of this. The supply side is absolutely important. And the framework that Andrea showed on public health, about surveillance, looking at risk factors, and then looking at interventions and evaluating them, what works, is really the way of the public health approach, and working with communities to translate that, to make sure that what we're cooking up is really going to be meaningful, especially since a lot of our communities, that there are intersectionalities that the first panel highlighted for us. So thank you. And so we are towards the end of our day together. Very informative. Brian, yes, it would take days to get into more of the issues, but I've already gotten texts and some chats on how so far that they've learned a lot, taking a lot of notes from the two panels today. We've heard from Attorney General Rob Bonta from our first panel on evidence of intersectionality and equity among impacted communities, and the panel that we just heard from the public health actions taken to fight gun violence, and all from us, as Brian said, from credible messengers. So I turn now to another credible messenger, my colleague, Mark Peterson. We are at the point to reflect on the day and look forward to the possibilities that California's public health leaders can consider for the future. Knowing, as Brian said, it's not all about the big P policies. So I think we'll have this discussion, I'm sure, a very deep and vivacious discussion in the next panel. So Mark Peterson is from the UCLA Luskin School of Public Affairs. He's professor and interim chair in the Department of Public Policy. As I said, he's the credible messenger. He is a trusted voice in understanding U.S. national institutions in the formulation and implementation of policy processes. So relevant to our discussion today, Mark studies the factors that shape the influence of research, evidence into policy decision-making. You can learn more about Mark. I think Tiffany has already been pasting parts of the bios in chat, but Mark's bio is in our program. Mark, thank you for being part of our year-round planning committee and for moderating the next discussion.
Thank you, Ninez. Can you hear me? I hope everyone can hear me. Thank you very much for that introduction and for the opportunity to play this role in what I'm finding to be one of the most fascinating symposia that I've had the pleasure to participate in. The topic couldn't be more important. The conversation, both from the research end on the panel, the first panel, and the second panel, with an amazing array of things that people are actually doing on the ground, and the opening from the Attorney General, put all together for me what I think is a particularly optimistic day on a very difficult and challenging subject for which it's very hard to have had much opposition and much optimism over the last many years. What we're going to do now in the next hour is, in some senses, try to bring the big picture, to take the ideas that we've been hearing and thinking about and getting responses to from the various panelists, and think about where we go from here and what's the larger way to move these issues forward. And for that task, we have two absolutely terrific individuals. But before I introduce them, I just want to remind the audience that if you do have questions, please put them in the Q&A, and we'll make sure that we have an opportunity to get those questions put before our two panelists today. Those panelists are Julie Nagasako, who is the Deputy Director of the Office of Policy and Planning at the California Department of Public Health. She has been in the Department of Public Health for nearly 10 years. She brings that big public health lens that we want to bring to this kind of subject, and has been working on that in a variety of domains, but it's really essential for getting to the kinds of things we've been hearing about regarding gun violence and preventing gun violence, using data and evidence to actually get to thoughtful policy choices, while also focusing on communities and focusing on and emphasizing the social determinants of what defines the quality of life in communities, and what really brings about the meanings of safety in those communities. She can help us explore how these issues that we've discussed today fit in with what California is doing, what it could be doing, what it's planning to do, and to do this in terms that fit into the public health epidemic lens of gun violence. Our other panelist today, Cuco Rodriguez, he's the Chief Equity and Program Officer for the Hope and Heal Fund. He has just long and vast experience in public mental health services, youth services, in philanthropy, and focusing in particular on advancing racial justice and equity, and doing that within the community engagement lens, and always in ways to promote systemic changes to empower communities and marginalized communities and protect vulnerable children. He brings a comprehensive understanding of the social roots of what fosters safe communities and prevents people turning to guns to solve the problems that they perceive. Now, this E.R. Brown Symposium has been explicitly posed as addressing gun violence as a public health epidemic, and has brought forward both research and examples of on-the-ground actions to reveal the efficacy of that kind of approach. That's particularly essential, as everybody here knows, without much prompting, that the conventional policy approaches, what Brian referred to as the big P policy, has mostly been focused on guns themselves, gun regulation. The kind of the euphemism now is gun safety. In the past, we talked a lot about gun control. But decade after decade, after a horrendous event, after tens of thousands of people a year dying either by suicide or by violence due to the guns, we've made precious little movement in this country. And there are really three reasons, I think. I'm a political scientist, and so I go to what explains that. One, to me, is that we have a national policymaking system. It's a very decentralized system, but it's one that's easy for those with power and influence and stakes, like gun manufacturers and the National Rifle Association and their allies in the legislative arenas of various kinds. It's easy for them to gain the leverage, to use all the veto points in our system to block change. And our system is not designed to really bring into the power system, bring into policymaking the populations, the marginalized and most vulnerable populations in our society who are the most victimized by these failures of policy. And so there's a real imbalance in the power structure and very difficult political coalition building. Second, we have federalism, which is famously advertised as a way to have a laboratory of democracy. But ironically, on gun issues, California can pass all the laws it wants. I think there are over 150 statutory provisions of some kind that control guns or provide for gun safety in California. But that doesn't matter very much when you can simply drive into the state with whatever you've purchased in another part of the country. I always am taken aback when I drive from Nevada to California and have to report what fruits I have, but not whether or not I'm carrying an assault rifle in my car. And then the third element, of course, is we have the courts, and as was mentioned earlier, the Second Amendment. I think we're the only country in the world that has a constitutional protection, not only for bearing of arms, but now the court has described that as an individual right to bear arms. And that means that no matter what the states and localities are doing, We know increasingly there are federal judges, including now probably the US Supreme Court, who are quite willing to throw out those provisions, whether it's California's protections in the domestic violence arena, or whether it's New York and how it extends concealed carry weapons permits, or Illinois that actually passes an assault weapon ban. That can all just simply disappear because they run counter to the Second Amendment and a particular court structure that might advance that excessive protection of the Second Amendment. So that leaves us with the public health approach. That leaves us with everything we've been hearing about today. But to me, then the question is, as profound as the research has been, as efficacious as these interventions are, as empowering as the examples we have seen at the community level, how do we bring them to scale? How do we make that the natural order of things across the United States? And how do we make it so that it's true throughout California, not just in certain communities? How do we make it true for the nation as a whole? My question then becomes, are we in a position to have a new politics and policy of gun violence prevention and predicated on public health oriented strategies instead of gun regulations? Or must we, in a sense, throw up our hands about the policy process and focus instead on a more organic mobilization, if you will, social mobilization, inspired civil society at the community and local level? And that's the big issue I'm going to pose to my friends here, Julie and Kuko. So let me start with you, Julie. From your perch in California government, the policy apparatus, you know, that's in a way where we find that big P a lot. And the Attorney General this morning promoted the fact that California is doing it first, doing it best, and is showing the rest of the nation. What do you see as the role of the public sector in all the things we heard today?
Yeah, what a tremendous question. And I want to just open to by just thanking everyone. This really has been such an inspiring and a humbling conversation to be a part of. And I think part of the answer to some of your questions also lies in the nature of the conversation we're having together today. I think my first response to what you're sharing is that I really don't think it is an either or. And that's very common for public health. We're big about comprehensive approaches to strategies and issues. And we need the big P policy. Big P policy has a role to play. When we think about the association of firearms as the lethal means in so many different forms of violence, doesn't make sense for us to ignore that. And we can look to public health models for other issues in spaces where there were objects that were accessible to the public but could cause harm, like motor vehicles and tobacco. Those are two examples where big P policy drove some of the largest public health gains we've ever seen in terms of reduction in mortality. And we still see that today when we're talking about firearms and we're looking at California compared to the nation. California has some of the most robust gun legislation, and we have comparatively lower rates that on a national lens. That is not enough because we can see we have recent increases, we have a surge in ownership, and we have disparities that have not moved despite those policies. So that tells a lot further to go, and that policy has a place. And so I think that that's a really important thing to take away. I don't think it, I'm hoping that we're not going to give up on the big P policy piece, but it is only one piece. And we also heard today several frameworks that sort of contextualize the issue in that way. We heard about the idea of sort of legislation that supports local intervention and prevention, that promotes social connection. How are we looking at awareness and involvement, as well as school safety? So there's this wider array of issues, as well as how are we addressing access and safety and safe storage? So I think that those are things that that prevention, intervention, healing, and access, those are great examples of models that are inclusive of that big P policy lane, but also are getting at a broader array of issues that I think we'll be eager to dive into.
Okay, very good. Thank you, Julie. Kuko, I know you come at this issue from really the collaboration between what I'll call action-oriented philanthropy and community activists who are working in the neighborhoods, on the streets, in their communities in the most direct way. What are your thoughts along these lines? Again, going back to Brian's comment about in introducing the second panel about the importance of the public health approach, including a widespread adoption of that approach in a variety of arenas. Again, as Julie says, big P policy doesn't go away, but there are lots of other tools, and there's the intersectionality of all the kinds that were talked about, in particular on the second panel. It's not just about gun violence, it involves the community. What's your sense, what's your takeaway from what we talked about today in the context of really advancing all the successes that are on the ground, but they're isolated successes on the ground, and we've got a huge national problem with tens of thousands of people dying every year.
Yeah, and I think to your point, I guess, just so I can kind of clarify, I think it's you know, what we're getting at is an issue of how do we scale up, right? How do you replicate this? Right. And I think that you know, to what Julie kind of stated, I think California is always been kind of in that place just because of just some nuances around California in terms of not only policy, but just other things that are political in nature, but also have to do with diversity of the state. And I think that as we make mistakes or we learn, I think that's the scale up strategy that other states look at. You know, with some of the things that California tries. I think that this is no different in that respect. And again, I'm not sidestepping the question, but at the same time, I am, because I think that there's still a lot of work to do, because inherent to your question, I agree, policy is not, is a really critical piece. But, you know, like for our fund, you know, we're a philanthropic fund, we don't do policy. So I would urge everybody to, you know, step back and say, and just ask yourself, what would you look at if policy was not an option? And when you do that, it forces you, you know, I'm an engineer in my prior career. I still very much about systems analysis and systems design. And you know, to me, the very simple way of doing kind of systems analysis and systems change kind of strategies is really to really assess all the variables that it may have a positive or negative impact on the results that you're trying to achieve or change. And so when you do that, policy certainly is a big part of that, but so are a lot of other things. And I think that for us as a fund, that's what we explore, is what are those other things? Because the reality of it is that policy, especially at the federal level, or policy at certain extents, are not variables sometimes that I can relatively change. And there are probably other opportunities that we can look at that we should be exploring that I think some of the other speakers spoke to before, haven't been given really the resources or the time or the focus, that quite frankly, I can tell you anecdotally in communities of color in particular, because we often get ignored as well in terms of this construct and this conversation and in other areas in terms of systems approaches to addressing issues that are impacting communities. I think communities of color have in many cases realized that no one is going to fix this but themselves. So they've actually done very good at decreasing certainly the issue of gun violence in some communities, at least holding it at bay or decreasing it in some cases. And they've done that out of necessity, out of just being impacted. And also, I mean, to be clear, they've done it because the systems that are in place that are supposed to address this have not addressed it. So it's important because I think that, you know, especially when we talk about policy, we have to acknowledge that policy, you know, that there's a lot of the democratic process, especially when it comes to race equity and representation of people of color, is imperfect. We're still working at that. So to your bigger question about how we scale in a way that includes policy, I think that it's important for us to really rethink how we've been looking at policy. A lot of policy, especially in the gun violence arena historically, communities of color have not fared well. So although it has solved issues for one particular community that's being impacted, it has had a detrimental effect on communities of color. And I think so, therefore, you know, I'm always hesitant when we talk about policy if we're also not talking about the importance of having equitable representation. And then again, I say redefining the way we do policy is really looking at policy from the standpoint of, is it a solution for everybody or is it a solution for one particular group that's going to displace another group? because that's what we've been calling solutions. And quite frankly, that's not a solution, that's displacement. So redefining how we're going to do this, especially in California, where the majority of the population are people of color, and yet our voice sometimes is not included in a lot of these policies that are supposed to help, and end up actually having the opposite effect. I think fundamentally, as Fernando pointed out and others, there's a fundamental problem that we really need to really ponder on when communities of color have distrust over law enforcement. Like, that's a really, and I don't think we should minimize that. And I say that because I think a lot of policy around the gun violence arena is very much dependent on law enforcement. And so that's a bit problematic because it's a very fundamental conflict that we need to address. The last thing I'll say is that I think, to your point of scaling up, I think that access is a big part of it that we need to focus on. But I think, as Julie was saying, the root cause piece and where this comes into play is how we develop policy that begins to not only address the access piece, but also addresses some of the root cause piece, which is that removing access is certainly important. And even if we removed all access to weapons in any shape, way, or form, the work that's really difficult that we have to figure out to do, and that to me, I think that's really at the heart of the hard work, is how do we address the issue of people who have in their mind created a mindset that the way to resolve a personal problem or a conflict is by taking your life or the life of others. That is, as some colleagues that I've worked with say, that's an issue of the heart and the soul and the spirit. That's not access, and access is important, but the underlying causes that create that mindset is really difficult work that we really need to engage in. And again, to what some folks have talked about, it really is about trauma. It is about healing. It is about connecting and addressing really longstanding issues of oppression and trauma in communities. So I'll stop there.
Thank you. Thank you very much, Kuko. I actually want to continue a little bit along these lines because it raises an issue of when one has communities, and that's been discussed today, when you have communities that are doing things that are really interesting, for instance, what Fernando Rivon talked about, having peacemakers and giving them training and certification, and they have the credibility of life experience. And you work on building these community safety approaches as an alternative in some cases, and as a supplement to a completely redefined version of what the police do in public safety. When that happens, does that get scaled up by having communication strategies to bring that model to other communities around the country? Clearly, it requires, this is what Hope and Heal Fund does as well, clearly involves funding. Where does the funding come from? Does it all come from philanthropy, or should there be a move to get public dollars of the sort I think Julie's looking at and that Andrea is looking at to move in that direction? Let me just give you a metaphor, or kind of an analogy. In a lot of the work I've done on healthcare issues through the years, I've had a lot of involvement with the Robert Wood Johnson Foundation, largest foundation in the healthcare realm. And they spend an enormous amount of money, but no matter how much money that foundation spends, they can move the needle just a tiny, tiny, tiny bit. It's only going to happen if people get the lessons that you've been talking about, if that gets translated into a more open, democratic, political and policy process, and we actually allocate resources at a significant level. Or am I getting that wrong? Kuko?
Yeah, I mean, I think that in terms of, we say that this is a public health issue, and it is. That also implies that public dollars should be utilized to address this. Philanthropy, here's the thing, and again, I go back, I don't want to make everything about equity, but everything is about equity, because we wouldn't be in this place if things were equitable in a lot of ways. And I think that, to me, I'll bottom line it for folks. Most counties in this country spend more money on the well-being and safety of dogs and cats than they do young people who die of gun violence, especially Black and brown young people, period. Fact. That's really, and so, I think there's a fundamental shift that has to occur in how we view this issue. And if it's a public health issue, it also means that we as public taxpayers, we need to prioritize funding to do this. And again, there's a lot of examples in everybody's county or everybody's community where you will find that the systems and institutions that are in place, public health, mental health, law enforcement, all of these folks, emergency operations, that's a big one, have developed very strategic, very wonderful plans that are doing what they're supposed to do. The issue is we have not prioritized this issue and said, hey, let's apply. Perfect example for me is, I live near Santa Barbara County, but a lot of counties have, in Santa Barbara, there is a emergency operations plan for fire to decrease and ensure that nobody dies in case of a wildfire. It has been successful. No one has died in the last 30 or 40 years because of fire. And we spent a lot of money on that plan. And to be clear, it's to address the issue that is one issue, which is fire, which is a big deal, that's affecting less than 1% of the most affluent in the county. And despite that, in the last 10 years, no less than 23 people have died of gun violence in Santa Barbara County. And we have a plan to make sure that that 1%, nothing happens to their property and nothing happens to them on that Riviera. And again, I'm not saying we shouldn't do that, but I also want to make sure that we juxtapose the example in terms of loss of life for people of color in Santa Barbara County that represent 40 to 50% of the population. And we have no plan and no investment of public dollars to that issue. So I think it requires us a shift in looking at that, but also prioritizing how our tax revenues, local and state and federal, are going to address this issue. Because at the end of the day, philanthropy, I worked at the Kellogg Foundation, very large institution. Even if we sunk, their annual investment is $400 million. Even if you put $400 million in one state or in several communities, it is small in comparison to the total tax base that we generate in the state of California, in most communities across the state. And more importantly, it's not a sustainable amount that these foundations can continue. And at the end, I'll say this last thing. Part of that shift is that this is a chronic issue. This is not an episodic issue. And if we start looking at this as a chronic condition of poverty and racism that exists in communities, that would require us to begin to invest and plan in that way. Right now, every time there's a shooting, we put money towards it and then we retreat the money and it just happens. And that's not the case. This is not going away. This is a chronic issue that is affecting communities. And I think we need to make that shift.
Okay, very good. Well, Julie, so you're here as the public sector and its new orientation in the state of California. Where are we headed on this?
Yeah, I think that part of the first step for some of these considerations is I think we have to frame the issue and the resource avenues and the interventions so much more broadly than I think much of the conversation has been centered. Not here today. This has been a good broad conversation among all of our wide partners here. But I think that in general, there has been a much more enforcement specific vision when it comes to resourcing violence prevention. And in reality, that funding needs to be a part of education, a part of economic opportunity, a part of youth development. The intervention looks like restoration of under-resourced communities. It doesn't just look like over policing. So it's trying to think about what are the nature of interventions that get at those root causes? And then what's the wide range of resource streams that are then available to help support that? What is our parks budget, our education budget? What's the role of enforcement when we're reconceptualizing that with the input of community experience? And certainly public health resources too. We love to try to find ways to leverage public health resources towards violence prevention. When we think about even the issue of violence, it's not violence in isolation either. We see the interconnectivity between violence and so many other public health issues, the crossover with the pandemic, the behavioral health considerations, suicide and drug overdose. How are drug overdose, which is an increasing burden of public health in our state, how is that connected to issues of violence and the drivers of violence? So what are the ways that we can broaden the frame and especially to be inclusive of social determinants of health. I think a lot of times the vision of what the strategies are that I think communities would identify, and we want to hear that from each community, look much more like asset building within their communities for areas that have been underinvested. And so trying to find out what are the ways that we can make that a part of our resource prioritization process, which is also a policy process. And I think to make that resilient, how do we, what are the ways that state, philanthropy, local government, what can we all do to create more spaces and avenues for community voice in that policy process? So it's all coming back to that same conversation that we started off earlier on, is that the solutions and the voices that are helping to influence where resources are going and what those interventions look like need to take a different shape and come from a different place than perhaps they've been centered so far.
Yes, and let me follow up on that. In the it takes you right back to the conversation that Andrea Welsing brought up, which is what are the real challenges? Funding silos and coordination. Is there anything about what can be done in California, for instance, and the kind of work that you're doing within the executive branch and working with the governor, but also working with the legislature, that can eventually create a different kind of decision-making model where the funding is not so siloed, it's not so short-term, and there is a capacity to coordinate across what are just arguably separate departments, separate agencies, and that's at the state level, then it's replicated again at the county and the municipal level. How do we overcome all that?
Yeah, that's a wonderful question, and I won't pretend to have the solution here today, although I do think there are a lot of bright spots that are suggesting to us areas of opportunity. I also think that sometimes those solutions don't always come in a package that might be ideal, but that doesn't stop partners across sectors from finding good ways to collaborate and braid and blend resources that sort of bring us to that place where we have support across a wide range of upstream and downstream interventions, because we've got players in all of those arenas that are so committed to trying to address these issues. I'll just give one example, but there are many. So this is just one specific one. I think that we heard about the importance of place as sort of this wider context that is influencing sort of how individuals and communities see their areas of opportunity. It is sort of concentrating risk from a number of different standpoints. And so place-based interventions seem to be one of the models that really focuses on trying to not make the lens for the investment the condition, or historically in public health, sometimes we say the body part, or even the individual population, but it's the community. So what are the ways that investments can move into communities? This is another great example of the way that philanthropy has piloted some of these interventions, and now there's state level investment. And I'll use the example of California Accountable Communities for Health Initiative. And so those are place-based initiatives that the community brings together multiple sectors. There's a backbone organization. Sectors come to the table and say, what is the health issue that we want to prioritize? Many times those convenings started around other health issues and ended up moving to the issues of violence and trauma, because that's what was more relevant to communities. And then what were the interventions that were meaningful for them? Then you're braiding together resource streams from both state, from the healthcare delivery system, and from other actors to be able to invest in and support those. And then those entities are flexible at the local level. So how can you have that local community connectivity that can then respond to different issues and needs that come up? I think that's only one example, but this year there's state funding that is scaling up that effort that was piloted through philanthropy, and then trying to see how we could do that in other places across the state. That's a tiny micro example, a wonderful one, and then there are many others. So I just want to acknowledge that.
Great, thank you. Thank you very much for that. Kuko, I have a question from the audience for you, and can be viewed as both a question and then maybe an opportunity again for a different kind of new politics on these issues. And that is, the questioner is raising the observation that there's been what is characterized at least as an increase in violence, gun violence, for instance, in suburban schools and public places that are essentially in suburban and largely middle-class areas. And again, often with assault weapons of various kinds. How does that set of how does that set of experiences relate to what you were describing as the fundamental problems of what happens in the in the communities that are disempowered and underrepresented and bearing the adverse consequences of policies in the big P policy world. And it's also, and then here's what I would add, is that an opportunity potentially to broaden out the conversation and make those who are facing these issues a more inclusive population that will perhaps empower that agenda?
Yeah, I mean, I think that that's consistent with the data. It's not consistent with the perception. We're actually embarking we've been doing work around GIS mapping, and in part it was really kind of the hypothesis similar, where we're beginning to see that, really what we started with is that the perception is that in California, like in other states, that homicides specifically are being driven by large urban centers. And I have to say that some of that is really part of the same kind of racist narrative around Black and Brown communities and so forth. And what we're finding, we did our first map, and we're working on an updated one. And our first map of the state of California bears out that almost 2/3 of all homicides in the state of California are in a rural, semi-rural, and non-urban settings. So I think it's important to point that out. It also is important, I think, along with that, is that in a lot of ways this field is very behind in terms of things that really exist. I've never worked in any field where there is a funded effort to ensure you don't collect data.
Yeah, right.
Right. So, and I think that's telling. There's also a concerted effort, which again just baffles me. This is a public health issue where the keepers of the data, particularly coroner's officers, sheriffs, or law enforcement, don't share that information. I'm just baffled by that. They're public officials. This is a public health issue. It's important information. And some of that, you have to do freedom of information requests to get data. I mean, so it's an important thing because all of these factors we're still working out that we have to figure out. And again, those are not issues that exist in other areas, and I think it's important. And the last piece, I think, to your point, that I think is really critical is that in terms of the way that we're looking at this, is that the community sometimes is left out of this conversation. In the prior question you asked about, what does this look like? How we can create this partnership and collaboration. And, in philanthropy, it's really interesting because philanthropy in a lot of ways has relied on community-based organizations as an intermediary. And I came from grassroots organizations and organizing, all of that. I think it's great. But I also think that certainly for us at Hope and Heal and other foundations, and I think government is starting to do this, is that nothing precludes us from talking directly to the community. And I think that that's the important piece because we forget that the priorities that we have as organizations are our priorities, and they may not be the priority of the community. And so when we don't engage in that direct conversation with the community, I worked in government. If government doesn't do it, is because they're frightened or they don't know how to do that. And that's problematic because these are the communities they're supposed to represent. And more importantly, they do that for primarily white English-speaking communities all the time, but they're not doing it with this population. So that's really critical. It's important. And then for philanthropy, it's really critical and important because it's kind of like a third party, like you're going through a third party and you're really trying to, you hope that organization has an accurate pulse, but at the same time, nothing is better than working directly with the community so that the community can voice out really what their priorities and what their needs are and how they're assessing the problem. And again, I think that part is really, really important because, again, sometimes it creates challenges for philanthropy and government because if we say, I used to do pregnancy prevention work and that was my priority and that was what my funding was for. And the kids would say, I have other problems like a condom. Thank you. But I have bigger issues. Can you find me a job? Oh, okay. Well, let me work. That's not what the funding's for. And I think that that's part of, what the community is reflecting back to us is your siloing is really not helpful. Like it's great that you're lining this up for me, but I need a job. So how do I do that now? And again, I think that that's a real important piece of it because the community is not affected by a single issue. It's affected by a lot. And sometimes we're single issue focused. And so having that direct conversation with the community is a really critical process, and that I hope that we adopt to begin to create more collaboration and figuring out how to bring in the right people that are doing the right different work, maybe not our work, but we're going to need to do that. And I think that will, I think, accentuate and help kind of blur some of those silos.
Yes, and this question from the audience follows up on that in a way, and it's also for both of you, which is going back to this fundamental notion of the historic, structural, systemic roots of why communities, particularly communities of color, are disempowered, and how they are the most affected negatively by that, and how the way we've set up our policy process and our funding streams and our siloing takes away from that intersectionality of the people that you were just describing coming in for pregnancy prevention. But there's a hell of a lot of other stuff going on in my life that would make a big difference. Probably not going to be very easy to do in many parts of the country, but California ought to be where we're at the cutting edge of how do we finally disrupt those structural elements? How do we finally empower those communities so that the political policy process, in addition to the community-based organizations and the kind of work that you're doing, Kuko, actually do have that voice, and we get a different kind of policy making? Julie, do you want to start with that?
I'd love to jump in, because I'm so appreciative that this is where our conversation is. I had a reflection when thinking about this day of when I first started working in public health programs. We were like uncertain about whether we were allowed to work on violence prevention, all stemming from sort of misperceptions of barriers around, the federal research limitations, and thinking how much more broadly that must extend because of political sensitivity around the issue. But today we're having an all-day conversation about public health, not just violence prevention, but gun violence prevention. We're saying, why isn't the policy process more centered on community and equity? I think that's so promising. It's frustrating because obviously we're calling out an issue that has been with us through this whole arc. But I think it's very encouraging to see that the conversation isn't anymore, is gun violence a public health issue? The conversation is, how do we solve this issue by really putting community and equity at the center? So I think that that's really exciting. And I want to make sure that, and I agree that I think California is in a place where we can make that the focus of the next wave of policy and public health intervention, and community action can be the policymakers that are on this call today, because I think all of the people who are contributing from a data, a community, public health, government, foundation perspective, all of those influence the policy process. The reason that we're having this open conversation about public health gun violence prevention isn't because there was a federal change. There were federal changes. Those federal changes responded to stakeholder and community advocacy from all of you, because just like us back at that time, we're having little conversations on our phone about, are we allowed to do something? We have to address violence, but how? That conversation was replicated at every community across the state, across the country. That has an impact over time. We want to accelerate that impact. And I think that we understand that the way to do that is if we can break open the doors and have that policy conversation. I couldn't agree with Kuko more, together with community, not alongside partners and allies and intermediaries, but together. And I think we're going to need help from all of the talent and insight that has shaped this conversation today to think about what that looks like. But I think expanding that next wave of the policy process, and if policy feels too narrow, then sort of the broader response strategy for prevention, I think is really exciting and hopeful. I really think that there is opportunity there.
Okay, Kuko.
Yeah, I think part of that question is acknowledging. I've been acknowledging past transgressions in terms of systems and institutions in this country and in the state, even local municipalities. I've been doing equity work. I tell people when it was detrimental to my career. We at least now, one of the byproducts, I think, of the unfortunate incident with George Floyd and others is that I think everybody in this country had to reconcile the fact that what people of color have been saying for a long time, that our interaction with institutions and our experience with law enforcement and other institutions is not the same. And I think that this country has struggled with that. And I think we've shifted, and certainly in philanthropy, but also in industry. You see shifts in terms of trying to, position equity, equity positions. I've never seen that in industry. But even philanthropy now embracing the idea that we have to acknowledge, and again, going back to that systems analysis, how is it that we're investing in all these things around inequity, but we don't talk about racism? That's the biggest factor. And so it's important to acknowledge these past transgressions, primarily because communities know, and they have institutional memory, and they know that just because child welfare services say that they're a kinder, gentler child welfare services doesn't change the perception. Just because law enforcement says, that they're kinder, gentler, that we're community focused, doesn't change the history, doesn't change the perception. So I think it's important to acknowledge that, because in many cases, the same institutions that are being asked to address inequities are the same ones that are complicit and responsible for creating them in the first place. And I say that because it's not really to blame. It's to bring an awareness, to state it and saying, let's not replicate this. Because I'll tell you, even in the gun violence world, after George Floyd occurred, a lot of organizations that we partner with, national, I'm not going to say who, said, we embrace equity, we embrace all of these things. And then, several of the largest gun violence organizations got invited to the White House. Not one organization of color, or no one representing people of color. And then we were sitting at a meeting and I said, hey, are we going to talk about that? They're like, well, that's not our fault. Well, no, it is. You can't say that you're about equity, that you're going to fight against inequities and then continue to operate in the same way. That is not going to happen anymore. You have to shift what you do. So I say that because I think that the acknowledgement of what has happened in the past and for institutions and people that represent those institutions is important, especially having that with communities so that we don't replicate that. And it isn't to blame, but it's also to make sure that everybody is on the same page or understanding, and so that we don't replicate these things. Because in a lot of ways, I will tell you, I worked in county government, and they've taken new positions on equity, but they haven't changed structurally anything that they do differently. So it really hasn't shifted in terms of, we're expecting different outcomes, but we haven't done any differently. That's not really going to happen. So I think it sounds nuanced, but it's a very, very important, uncomfortable conversation that has to be had. And I think institutions have to be ready to do that. It also is an example of how institutions can show communities that they're at minimum being genuine about having that conversation and beginning to take a step in the right direction for that conversation to occur.
And I think one of the issues that may pertain to that goes back to something you said, Kuko, about how hard it is to get data that should be publicly available. So we don't know that policymakers and the public and activists don't really know the empirical realities that are already there and that could be made more available. And these are often public data, whether it's from the police or from the Department of Justice or whatever it may be. And one of the members of the audience was asking, what can be done to get the Attorney General, who obviously is on board with this whole notion of a public health epidemic of gun violence and using that frame, how could the Attorney General leverage or be leveraged to use his role in his office to require more reporting of data by the police, require more reporting of data by local governments, whatever it might be. And is that something that would be important to do? And is there a strategy for that?
I mean, I'll just chime in there.
Sure.
In public health, data is our favorite, right? I mean, data is where we start in terms of understanding and evaluation and impact. So I think that makes so much sense. I'm hopeful. I mean, with what we've heard this morning around the establishment of the DOJ's Office of Violence Prevention, I'm imagining there will be a stakeholder process that's a part of that. I also think that there's going to be interdepartmental collaboration. We've heard that the DOJ is interested in pursuing a public health approach around that. So, and we're very eager to partner with them. And I think those are great issues to be surfaced about, those are systems things that can really have a big impact. And so I think that is a really great avenue potentially to address those questions. There's also been systems that the state has invested in to try to increase our understanding of data across systems. people may be familiar with the California Violent Death Reporting System, which integrates vital records data and Department of Justice data and coroner data in ways to help us to get a more three-dimensional picture about sort of the intersecting contextual factors that can impact a violent death incident. And so I think that those are ways that I think we've been trying to improve systems so that we can get better data. And then I think oftentimes public health entities or academic entities, like we heard from this morning, are oftentimes leveraging that data in ways to try to question it for understanding and analysis, and then share that information with communities. I also think that in government and in other venues, there's a lot of interest in community input to that process as well. What are the questions that we want to ask in terms of data analysis around the impacts of violence? And how do we, when we think about sort of a structure of equity and use of our data, how are we engaging with community around interpreting the data that is seen to say, what do you see here? What are we missing? What else should we be looking at so that we have a more comprehensive picture? So I do think that there's opportunities from a systems perspective to try to improve those connections. And then again, another lens for community engagement here too.
Coco, do you have thoughts about that?
Yeah, I mean, I think that I personally believe that it's very negligent for law enforcement not to release a lot of this information, because it's negligence in terms of the public safety. And I say that because the question you asked is forcing law enforcement to report. Like there should be no reason why we're not. This is needed information, especially right now. I mean, we've had mass shooting after mass shooting. How tone deaf do you have to be, not as one organization, as a whole institution that is supposed to be centering your work around the safety and well-being of communities, and you're not reporting data that benefits the interest of the community in terms of how we address it, how we gauge it, how we identify, early risk factors, a lot of these things. And I think that I say that because it seems like a seemingly like not a big deal, like they're not reporting. It's a big deal. It's a function of their work, and more importantly, it's a priority for every citizen of this state and of this country right now, given the state that we're in. And I say that it's part of the unfortunate trend that we see, and that we've afforded law enforcement latitudes that no other public institution is afforded. Let's be clear about that. And more importantly, the one institution whose sole task is really public safety, and they just don't want to do it. I mean, in public health, if you didn't report something, how long do you think you'd be employed? Right? So I think it's important, because I think that we've afforded law enforcement a lot of latitudes that are not afforded to other institutions, and it's not in the best interest of the community and the population. The other area is that I think that, anyways, I'll stop there.
Yeah. Let me switch a little bit to perhaps making the challenges even greater, building on a question from the audience. And that is, and also recognizing that we have in the audience right now a number of young people, a number of students. After the symposium, we're going to have a student session. They're the next generation. And that next generation, as our participant in the audience has suggested, is dealing with a whole host of complicated, enormously detrimental issues. Gun violence, other kinds of violence, one of them, climate change, one of them. And there's this kind of, and the Attorney General this morning said, you don't have to wait, you can be active now, you can have a voice now, you can be a leader now. But they're facing this enormously complicated world. What is your respective messages to younger people who are listening in the symposium right now, or those who might get involved in this issue going forward? What's to hold on to be energized, to be made optimistic, to think that there's really traction here, and thinking that it's in a world in which we can't even grapple with what many call an existential threat. We're not dealing with this threat as well. Do you have if you had a young person sitting with you right now, what would be your story? Kuko, we'll start with you.
I think I have a lot of hope for the younger generation, because I think that they're teaching us a lot about our capacity to be more inclusive. And they also are seeing the world in a more systemic fashion in terms of the interconnectedness. I think that, where I think we make mistakes is say you need to get involved in gun violence, and it's kind of similar to the way that I'm talking about this, which is it's not just gun violence, it's everything else that's connected to it. It's equity. And I think in that respect, that gives me a lot of hope. I think that the challenge exists for a lot of folks of my generation who've been doing this work or doing this work, in not recognizing that they're going to challenge the philosophical framework of what we've designed and they have not been part of, and they're going to change it. And we need to be okay with that. And I think that I, for one, welcome that and urge young people to participate in that respect. But I think that on our end, we need to be very open in this movement, whatever public health, whatever it is we call it, but that we need to be open to make sure that we're inclusive of how they're viewing the world. And more importantly, we need to acknowledge that we may not have been in that same place that they're at now, in understanding how they view the world.
Okay, Julie.
Yeah, what a great question. So here's two small things to start, and then a bigger picture one. So one, take more stats. I wish somebody had told me to take more statistics when I was younger. I didn't know anything about public health. I was just excited about social justice, but I didn't realize how helpful data could be to that conversation. You don't have to do that. If you do, though, it can be useful too. I think the other thing is, I'll say this first, which is about listening, like to not underestimate the value of listening. Your voice and your perspective and what you see is really valuable. And the degree to which you can also see what's the landscape that you're trying to change and what are sort of the conditions and priorities of those entities, that will help you to influence that change. So I think listening is an underrated strength as well. So you can pick one, listening or stats, or better even, you can do both. But then I think my broader point would be, whatever your thing is, that's the thing we need. And that's very general, but I think that whether you are passionate about community level action and walking with communities, healing trauma, mentoring youth and peers, or whether you are like, I want to dive into the research and the data, whether you want to lead the policy effort for the next federal gun legislation change, whether you're a community organizer, whether you are an excellent communicator and a digital native who knows how to help us combat misinformation and disinformation and othering that can kind of really exacerbate circumstances of violence. Whatever your strength and passion is, it is highly relevant to this wider set of issues that we're all dealing with together, which are about how we strengthen our communities. And I agree, it's not about violence prevention. It's about how we have strong, responsive, connected communities that can help us, whether it's climate change or drugs or violence or a pandemic, whatever it is. Strong communities that are well connected can help. And you have wonderful, wonderful vision and strengths to contribute to that. And we're very excited about your contributions and support.
Great. I think that's going to be, for most of you, very inspirational for students and younger folks in general, and where they'll be taking this issue. Let me take this issue of younger people and go back to something that Kuko was mentioned and George Tita and others mentioned, which is ultimately, it's really getting to the root of what causes violence to happen, what causes gun violence to happen, what causes someone to pick up a weapon and try to solve a problem with the use of that weapon. That's not something that emerges usually when you're 40 years old. That's something that is, in a sense, embedded in the social DNA, in the way people are growing up as they're going from being a child to an adolescent to a young adult. That's a pretty hard charge to take on. And Kuko, you talked about the heart and the soul. Talk about something that seems really far afield from Big P policy. How do we, while motivating our young audience to go out and take charge on these issues, how do we also just, with everybody in younger ages who are growing up, often in very difficult or challenging circumstances with lots of forces having an impact on them, how do we get to that heart and soul issue and really break that notion that is so embedded in this country that you solve problems either with a fist or a gun?
Yeah, well, and I would say that we, you know, part of the challenge is that we're viewing it through a very white context. This is not a foreign thing, a foreign concept or way of operating for indigenous communities, Native communities, you know, communities of color. You know, we're now discovering things about practices that we've had. I mean, look, a lot of our communities wouldn't even be around if we didn't have a lot of these practices and traditions and resiliency, whatever you want to call it now, that have made us survive. And I think that for a lot of these communities, speaking in those terms is not a stretch. They operate that way. And I think that for at least the work that I've been involved with and some of the organizations that I've worked with, they function on that level. And yes, what has been the challenge, I'll be honest with you, in my career and in a lot of these organizations in terms of the work that they do, is being able to explain to white people what it is that we're doing in terms that mean something to you. And I think that that's been the challenge. We're getting better at that, but I think that a lot of these concepts now are being tried, and maybe they don't have the evidence through research yet, but I can tell you that the community believes in them and they're working. I am a testament to, I think, some of that, because I think to your point, what we're also forgetting is that in some communities, violence exists, and you know, we have to redefine it and look at it the way, you know, it's kind of like assertiveness training for who? Because assertiveness training in my community might look a little bit different, and you may term it aggressive, but it isn't. It's a deterrent in some communities. You know, try assertiveness training in a traditional sense if you're in prison, not going to work. And it's still assertiveness training. It just looks very differently. And I say all of that because I think it isn't just as a point of jest. I'm not joking about it. I mean, it is and it isn't. But I think that there's a lot of realities to the context in terms of the environments that people are living in, where sometimes, you know, the appearance of violence or things that seem aggressive in other contexts maybe kind of be asserting yourself. But I think that there's also organizations that are doing a lot of work in redefining alternative ways, instead of, you know, this is the, you know, when I worked with gang members, their only solution to certain problems was violence, because nobody had explored to them what other options exist, or can we create other options so it doesn't have to be this. And I think that we forget that some communities are kind of, this is what they have. So we need to shift a lot of that. And I think a lot of organizations, I say it's hard work because it's hard work in terms of it requires a lot of one-on-one. But I think that the shifts that have to occur is that our institutions have to acknowledge that this is, you know, mental health is wonderful, but in many communities, traditional mental health doesn't work. Because of a lot of the stigma, a lot of the things that are going on in those communities. So we have to be open to these alternative ways of doing this. And there is efficacy, there is evidence, all of that exists because they've been around longer than traditional systems that we have. So. Okay.
Well, we're almost out of time, and I want to close by giving each of you a brief opportunity. We only have 2.5 minutes at this point. A brief opportunity to say, what's the one thing that you want to get out there that we didn't tap into in this conversation? Why don't we start with Julie?
Yeah, I just think it's a reiteration of a couple key things. I think one is that we need it all. We need policy, we need community level intervention, and we need to connect those things much more intentionally. And that we are all of the partners that are here on the call today, we all contribute to a prevention model that is multifaceted. And I think that that's the strength of public health. I do think it has a resiliency that can overcome some of the politicization of this particular issue. So I think that that's really critical. The other thing that I feel like we can just never talk enough about is the fact that upstream conditions are creating the circumstances in which we're talking earlier today about young people's exposure to homicide, and we are measuring it in meters. That's an environment, and that environment is constructed not just in a violent incident, it is constructed over decades of underinvestment in communities, and which has issues of equity and racism driving that in systemic ways. And until we address that, we're not going to be able to turn the corner on this issue. So I think the emphasis on the upstream, the inclusive, there are many, many different ways to contribute to this issue, and that we really need to revision and expand our model when we think about policy with a stronger equity and community-driven lens. So I think that's really exciting.
Great, thank you, Julie. Kuko.
Thank you. I agree. And thank you, Julie. Appreciate being on the panel with you. And thank you, Mark. I think I'll only kind of add to what Julie said, which is, I think at this point, we need to acknowledge that no one person or organization is the solution, but that we're all part of the solution. And not one of us or organizationally, we're going to solve it. We have to solve it together. And I think that needs to be the mantra. That needs to be really the focus. And anything outside of that gets in the way of that, then it should not be part of this conversation. If we stay focused on that, I think that begins to be the mission that drives us. And so when we argue or we disagree, saying, is that helping this focus? No. So let's get back to that. And that has to be it. At the center of it, again, like Julie said, it has to be what the community needs, what the community wants, not what benefits our organization or our institution or the mission or our priorities.
Right. Well, thank you both for a really, to me, fascinating and terrific conversation. The downside of being digital is you're not getting the stand-up applause that you would have if we were all together in the ballroom at the Luskin Conference Center, but I'm sure there are a lot of people out there just extremely happy that they devoted their time today to the symposium and in particular as well to this conversation. And thank you to the audience members who submitted questions to help stimulate even further conversation. And with that, I will turn it back to Ninez.
Thank you so much, Mark. And thank you, Kuko Rodriguez from Hope and Heal Fund and Julie Nakasano from the California Department of Public Health. So looking at both community solutions and statewide solutions, but always emphasizing, I think the big P here is populations. So there's a lot of work to be done. And today's speakers are blazing the trail. We brought together leaders building an evidence-based research, practitioners on the front lines of community programs, and public health leaders seeking to advance both policy and programs that help make our neighborhoods safer from gun violence. And as Julie said, they're listening. So we're all listening to each other. Our goal was to stimulate positive conversations that lead to tangible change. As Attorney General kicked us off this morning, the time is now. So in the spirit of his call to action to our youth, I invite students and youths to join us in our next session beginning at 3:15 p.m. and will last till 4:30 p.m. The panel will be moderated by Kuko Rodriguez, who you just saw from Hope and Heal Fund. And our panelists will be Jason Madison from Rise Center, Gabriel Garcia from Youth Alive, and Wilson Hammett, who is a doctoral student here at UCLA Fielding School of Public Health. All of this work engaging with the community and with our students exemplifies the vision of Rick Brown. I know he's smiling down on us, and once again, we owe huge thanks to Mary Ann Brown for funding this annual event. Please come back to our website for future releases of policy briefs, more data that will bring in new data and evidence to address the many issues that have been raised here today. Thank you all for joining us.